not gonna be here tonight.
Chairs go up for some people.
No, you know what?
Well, they don't go, yeah.
On this
inside.
side.
Right.
Lynn figured it out.
But
I was
it's-
trying to
which-
figure
which
out.
one?
I've had chairs like this.
Right side.
I need
Well, I
that
was
one,
trying to
Al.
do the left
Need this one?
but it must be the left.
Oh, there's
one.
another one on the other side?
Oh.
Yeah, the right.
Sorry.
Right side.
I took this chair.
The right side is the elevator.
You're like, I'm more than
Hi
fine.
guys, how are you?
Good.
Nice to see you all.
I gotta grab a couple more waters.
How's it going, okay?
Yeah, I'm just, I think me being closer makes me less likely to be on time.
No, it's closer for me too.
Yeah, well, I mean, I just came from across the street.
Yeah.
Oh,
So
so
I'm
you're
like,
really,
oh,
I thought you
got-
meant from home, but
No,
yeah,
I
no,
was
of
at
course.
the hospital, yeah, so.
Yeah, I just
I got
jogged
time.
over.
This is here in front of me, is there a reason?
No.
I think
Those
I
are,
was
each
given
of
those.
us
I just
have,
got
Adam got us a copy, so we have each.
Where's everybody else's?
I'm gonna say.
I already got mine, here's, Ashley's is under this.
Oh, I didn't get one. That's, well, I have this already, I think, but I'd like one of those,
Yeah, I know.
because I've got.
Here, Carolyn,
I
you
got a
don't have
discount.
one? She don't have one?
No, but if you can have it, Rich.
I already have copies.
Oh, you already have this one?
Yeah.
Okay, cause I've got the big boy, but I'll totally read this.
I have a brother named Robert, so I don't need that.
Yeah, you just do whatever he says.
Somebody drinking beer already? No.
No, it's just water with bubbles in it.
Okay.
Spicy water.
This is nice. Who got these?
Adam bought those for us.
Okay, very cool.
Well,
think this is-
I told him I have this like sparked, I bring this to all my meetings.
Yeah, no,
It's-
this
it's,
is definitely
like,
good,
legit helpful,
given
I
the
think.
sign of the times.
So, well, we can talk about it at the meeting, but,
Mm-hmm.
we're gonna discuss and talk about a little bit about the bylaws too,
Okay.
so.
Yeah, we should.
Did Carolyn get a chance to? Just okay, huh?
Well, I think we're gonna, see if we can get the committee.
Hey, Adam, do we have a flag somewhere?
We do not, the county has not put one up in any of the rooms I'm aware of.
I asked that, if I'd have known, I'd have brought one, I have,
Yeah.
I think the county commissioners are the only one that have one.
I have plenty of them.
I can put a flag on the screen.
I was gonna say that is
That is the,
better than not having one, but,
my understanding is that we're the first persons to use this room or any conference room besides the county commissioners, area.
Okay, so you ready?
Wait for the flag up here.
thank you.
Yep.
Welcome, everybody.
So, yes, good afternoon, everybody. Thanks for everyone coming. We are being filmed. Thank you to ADP. Hopefully, we're gonna have the flag up here, and then we can all stand for the Pledge of Allegiance.
Trying to find a picture.
I was
Okay.
like, is he really on Amazon?
I thought I was gonna put a picture up, but not.
So we'll call the meeting to order. It's, what time is it? 5 o'clock,
Not.
That'll work.
okay?
Just zoom it out.
Everything goes to Amazon.
Please rise for the Amazon flag, for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay,
Flag on the screen.
so the next item is the approval of the prior meeting minutes. Does anyone have any comments? I think I had a couple questions.
Yeah, I have some comments as well.
Okay, start, whoever wants to go first.
So it says, as far as the previous minutes, the approval, Mrs. Breaky asked that acronyms not be used. I just asked that the long form be used before the acronyms. Yeah,
Okay.
so I don't have a problem with the acronyms, and actually the way it's done in these minutes is right. Oh, Alta's doing. Okay, and then my other comment, page 1, last paragraph, the flag is dragged along the property line. Should be the flag was dragged, or is dragged, not drug. I think that's all I had.
And then I had, on page 2, under financial report, it's just some typo. Mr. Lakey will be attending school superintendent's meeting to continue to build the communication versus,
Oh, I actually have that too.
Communition.
Yeah.
and then, I believe the sentence further down, that it was recently reported at a county administrators meeting that Job Family Services staff raised 5% salary increase. We did say that, but there's no reference, and if somebody reads these minutes, they're gonna go, why is this here?
Mm-hmm.
I mean, it needs a little bit more explanation, that's all.
The last thing Rich just brought up is at the very end under meetings says regular board meeting, Wednesday 27th, but it's the old address, so we'll just have to change it to this address.
Okay.
Well, at that time, we didn't know where we were meeting,
Yeah, we
Yeah.
weren't sure.
so.
I'm fine with that address staying there, but just
Okay.
Yeah, I agree.
Alright, and was there one word that was misspelled on the front, the top couple there, or you only got that?
Carolyn got flag drug.
Okay.
Yeah, that's all I have.
Drag.
Did you get another one, Rich?
I thought I did. Let's see, can I see that? Okay, I
It's
guess,
just small typos except for,
Yeah.
yeah, okay.
if that
The
sentence
only
can be
communication
modified,
is the only one I
about the
saw.
reference to the 5%, so it makes sense.
So.
Do you have a
can we approve the
suggestion, Lynn?
minutes
I think
as
it may
modified?
be more helpful to have a suggestion. I mean, we could either
Mhm.
just delete that in sentence or entirely, or
I
do you wanna
think-
add?
I think it could be deleted, otherwise you just need to add something like, this may become an issue with GPH or something.
Yeah, I would suggest just deleting that sentence then.
Yeah, it just doesn't,
I'm okay.
I know why we
said-
said it, but I don't think when you read the minutes it makes sense. So delete it, and I'm fine with deleting.
Thank you, Alta. Okay, so do we have approval to, approve the minutes as amended? A motion.
I motion to approve the minutes as amended for the June 22nd, 2022, regular meeting of the Board of Health.
Okay,
I'll second.
we have a second. All in favor? Aye.
Aye.
Okay, those are approved. Next thing is, environmental health update.
Yeah, okay, both is. Mr. Lark's not able to be here, he's actually on vacation this week. Everyone got his reports up on the screen as well. It just kind of was the inspection numbers, that everyone received. I know, we don't have a projector. The projector actually comes down over top of, the flight gentleman's head, actually. But that was just the general, statement from Mr. Lark with the inspection numbers that were done. We also did meet with, the Ohio Association of Realtors yesterday. They wanted some information about O&M and FSOP. We did a quick video with them, very quick, and then, they got some B-roll footage and whatnot, so that's kind of where that's at. We are working on the operation and maintenance stuff still, as well as some fees and things of that nature, which we'll bring to you. I'm hoping we bring them in August, because the reality is we need to do first, second, and third reading in September, October, November. They need to be active in December, that way, so January 1st, they're fully in effect. So, we should be bringing fees to you guys, as well as justifications what the previous fees were from before by next month. You'll give them advance, not like at the board meeting, you'll give them advance of that. We're hoping to have everything to you guys by then, so you can review them.
Where do things currently stand as far as FSOP inspections?
They are voluntary, so if you'd like.
No, I mean, how many are outstanding of the involuntary ones?
We're still going through getting all the updated numbers, given Evan's going through and some other things, and then obviously some are getting knocked out, some didn't qualify in the first place, so we're knocking things out here and there. It's still more than a year of backlog though, just of 2 full-time people doing nothing but that.
But I
That's
think like an
case.
actual number would be helpful.
Yeah, that's what.
I mean, I
also-
understand what you're saying as far as time, which is helpful as
Yeah.
well, but like, you know, are there 3,000 outstanding, 2,000? How many are being done each month? I think that sort of data would be helpful as far as, how and when to start implementing O&M.
Yeah, we have all the staff, Evan's going through and getting numbers for that, and just kind of clarifying which ones would fall off. Operation and maintenance, In my opinion, we need to have that, at least the NPDS systems of it up and running by January 1st, or at least around there, if we wanna maintain the rest of O&M and get it in place at a reasonable time frame. It might be pie in the sky, cause there's a lot of work to do up until that point, but the reality is, we need to start, cause if we keep pushing this off, it really needs to be up and running.
Right, and the number here, so there was 344 inspections in this 30-day period. Is this fairly normal, or was this like people knocking it out a little bit more than usual? Because we've never seen numbers before.
Yeah, I'd honestly have to ask Mr. Lark, 'cause I don't know, I know campgrounds and House Bill 110, we're kinda trying to knock those out relatively quickly. The others I'd have to ask Mr. Lark, honestly, just given, I don't see some of those smaller ones all the time.
Okay, I think a report like this in data as a whole will be very helpful in us understanding.
Yeah,
the scope, that's all.
Mr. Lark and I were
That was
talking
good.
about that, just to give you
Yeah.
guys an idea of, it's easy to say you did inspections, it's a lot, it's better to hear we had 300 inspections, or 20 inspections, or 200. That way you understand what the taxpayers are paying for, and how much we're doing in a time frame. So he will have numbers in the future, kinda like this.
Yeah, this was helpful, thank you.
Yeah.
Okay, is that everything, Mr.
Yeah, that's everything from
Adam?
Mr. Lark.
Thank you. So population health, Carol?
Are there any questions on what I had submitted previously, cause I do have a couple of updates.
Yes, I have questions.
Okay,
So, on page 2, the vaccine rate, the hospitalization, the cases, was that Geauga County or is that the state of Ohio?
Geauga County,
That's Geauga County.
that's Geauga County.
So we have 506 cases,
For that time frame.
and this time frame on here was,
6/1
Right,
to
6/1 to 7/14. wow,
And then are
Okay.
we,
No, but you have to remember that, these cases are being reported, not so much people, if you talk to the infectious disease people right now, they will tell you that almost no one is being admitted with COVID, because of COVID.
so it's a
They're-
with COVID, not from
They're being
COVID?
admitted, everyone who gets admitted gets a COVID
I can
test.
set this
And all of these are patients who are admitted with COVID, but not
because of COVID, okay.
And then the other thing I noticed under hospitalizations, it says children hospitalizations, I assume that's because
There's
it's 0, okay.
There's 0.
Because we don't have a peds department.
Okay,
And now, it used to be, when this data was broken out, it was broken out versus vaccinated versus unvaccinated. And I've noticed now, I mean, because this is from Ohio, they're no longer doing that, correct? And what is the reasoning behind that?
I'm not sure when ODH, I'm not sure why they changed, I'm not sure.
They don't always give us the reason why they make a change, even when it's asked.
They'll go in and update if they make any changes to their website or their dashboard, we'll get an email of the changes, but we're generally not included as to why it's being changed. There is an update with it, I'm sorry, anything else, Lynn? I didn't.
no, that was fine, I was just looked at those numbers and I
Oh,
thought
I had
they
one
were-
more question too. So as far as this percent vaccinated, so what counts as vaccinated now? Is that 2 shots, 2
It's
shots,
two.
and 52
You have to
boosters?
have the whole series,
So
not the
two shots.
boosters, just
Okay.
the primary series you have to have is what the state ODH recognizes as,
Got it.
okay? Alright, okay, so we got our first suspected case of monkeypox in Geauga County. It's a suspected case, we're working with ODH and CDC and the patient's primary care physician, to make sure that, to just ensure that the patient is getting the appropriate care. So as far as Geauga Public Health, you guys realize we don't dispense, we don't carry medications, we don't diagnose. Our role in this will be doing contact tracing with it, because it's highly communicable. So once, they are put in right now, they're an active case in the Ohio Disease Reporting Software right now, ODRS. They're in that system. Once we get an actual confirmation, they're in a suspected, we get the confirmation, then we will reach out, contact, work the case, see who they've been in contact with, and give instructions. And then we get involved as far as case management, where we reach out to the patient to ensure, as I'm sure their primary care will, to ensure that they're taking their medication. Is there anything that we can do for them just to case manage it? So I
Can you just
wanna-
give us a quick over on monkeypox? Just,
Do you wanna take this?
I mean,
It is a self-limited disease. It's it is not a we don't see a lot of it in OBGYN, I have to tell you.
yeah, we haven't seen a lot of it anywhere.
But exactly, we don't see a lot of it anywhere. It is not something that really is fatal for most people. The people that really have to worry about getting monkeypox are people who are immunosuppressed. And the obvious one is patients with HIV. Since this is mostly being transmitted from men having sex with men, they are the most likely to get it, and if they have HIV, they're the most likely to have complications from it. But it's somewhat easy to treat, but it can go untreated, and it has about a 2-week course. It's not like this is Ebola or anything that's fatal. It's a virus that's there, and to be aware. And
They did release a statement, the CDC, on my ODH call today. Ohio Department of Health really doesn't have a lot of information on it. They're directing everyone to the CDC's website, and they call it monkeypox page, is honestly what they said in the call today. So I went on, I looked it up, and it's the release that was done back in June by like the Biden administration as to monkeypox and what their plan of action is going to be. I do know that right now that the US, if you read that article, no one in the US has died from it. It is highly communicable, usually through body fluids, but if you were to an extended period of time speaking closely with someone, because it's body fluids, it's rare. There isn't a vaccine for it right now. They kind of treat it with
there's an experimental vaccine, right? And they've been trying it out. I understand that they immediately ran out of it. But like last week, I think there were 4 cases in Ohio. This week, there's up to 18 cases in Ohio. We're on the low end as far as states go. The busiest one by far is New York.
California.
Followed by
A little
California.
bit in California, not as much in California or Texas. And there's about half as many as in Florida, most populated, and but New York by far. And my understanding is that most of the cases in Ohio were related to people from outside the state. They weren't bringing it in, so.
Okay.
But
It's
we'll see how it evolves,
Okay.
yeah.
That's what I was gonna ask
And
about the Geauga case. Was that brought in, I assume?
they are linking it to travel.
Yeah.
Yeah.
Okay.
They travel.
And monkeypox is big in what country? Africa?
The Congo.
Congo?
It's endemic in Congo, and there's about 4 or 5 countries right there on the equator. Actually, they're below the equator. But and their rate is not nearly this high, okay? But it is endemic in those countries, and it really hasn't traveled outside until just recently, and it is in Europe, and now it is in the US. Also, actually throughout the Western Hemisphere. So, it's worldwide right now.
Okay, thank you for the short version.
Okay, everything, Carol? That's it?
That's good. Anna, do you want me to bring up about the childhood immunizations, or is that really relevant?
Yeah, if you would like to. We met with Dr. Reed today.
We met with not about that,
Oh.
the COVID ones.
Oh, yeah. Yeah, go ahead.
We were curious, obviously we've scaled way back to COVID clinics. We have other things that we're kind of focusing our energies on, but I was curious as to, speaking with Adam, how many children, when I say children, age 5 to 17 years of age, we have actually given immunizations to for COVID, because we get inquiries about that. And we pulled it up, and we've done, since the vaccine was eligible for this age group, 264 children. That's it.
Have
So-
gotten vaccinated?
That's
From us.
gotten
For COVID.
both.
From the
That's
health
gotten the
the health
primary
department.
series.
Okay.
There's only 264. So
Okay.
I knew it was an incredibly low number because we just don't have them. Parents, I think if they're going to do something like that, I'm assuming they're talking to their
Well,
provider.
nationwide, it seems to be pretty low
It
too,
is,
particularly
yes.
in the 0 to 5 range. I think
Yeah.
I read that it's 97 to 98% of children are unvaccinated from COVID. So that seems consistent with what's going on across the
Correct.
country.
But I was just curious because I wanted to know, because we've had some inquiries about that. And it's really low.
And when Dr. Cameron and I were talking, you know, you're not seeing those kids get incredibly ill from it, you're not seeing them die from it.
Right.
And that's probably the reason, it's not, you know, I mean, that's probably the reason, so it's just common sense, if you're not seeing it, you're not getting it, why, you know, take a chance. So, but yeah, Carol and I were talking, cause there was the email actually sent all of you from Heidi Fur, you know, that was, Carol and I were already talking about, and I said, you know, why don't we just pull that number and just see what it is? We knew it was low, we just didn't know the exact number, but 264, most of them, to our knowledge, are probably going to their PCP, their primary care physicians, you know, UH, whoever,
Or the parents are just opting.
or opting out,
They
right?
don't-
It's the parent's choice.
Yes,
It's the parent's
correct.
choice. We're not mandating anything.
But I just thought that was an interesting
Yeah.
number that I could share with you.
Thank you.
Any other questions? That's all I have.
Well, and then what's the status as far as the COVID clinics? Cause they were paused and the funding's running out.
Well, we've had them on pause, we're going to start them back up, but with the move, strategically trying to get the vaccine, there is, several vendors that are involved in getting the vaccine refrigerators and freezers here. So Lake County is holding all of our immunizations, COVID and adult and childhood immunizations. We have everything here up and running, we put the data loggers in, everything is doing great, but we have to have the dry contacts hooked up to our security system so that if there's an excursion, we're alarmed. So I can't put vaccine in there, however, the security system is coming, our security company's coming tomorrow to hook everything up. And then according to ODH guidelines, we have to, once those are hooked up, record temperatures for 48 hours, and then we're good to go. So then we will start our clinics back up. That being said, they're nominal. We're doing them on Wednesdays only, by appointment only. We do not have the staff, we have scaled way back, I have one nurse. So between
That's the state nurse or is that
No.
OVA?
I have 2 state nurses currently right now, but they're only gonna come in and help out on Wednesdays. I will not have them any other days. For that, so that we can do childhood and adult immunization and run our TB clinics.
Okay.
It frees up GPH's nurse to be able to do that.
Everything's gonna be by appointment, all.
Everything will be
Okay.
by appointment only.
We just don't have the staffing to, I mean, I'd love to say you could just walk in, but the reality is we don't have the staffing to do that.
So it seems more efficient to do it that way.
Yeah.
Yeah.
So I guess a question with respect to that is, you guys have, we've had a lot of rabies vaccines and the immune globulin and the ED, and I know they have the option for the follow-up vaccines to go to a different entity. Are you guys providing them the subsequent vaccines
We
for
do,
rabies?
but they have to let us know, and then
Okay.
we have to order it, and it's at their expense. Geauga Public
Okay.
Health does not pay for that. We do work with the park system.
Mhm.
Once again, the park system pays for it. We get the vaccine in, and we treat like all their rangers.
Okay.
But
Interesting.
yes, we have had a couple people come off for travel reasons,
Mhm.
wanting the vaccine. They paid for them, and we provide them.
Okay, and those are by appointment, but not limited to that Wednesday clinic then, but they have to let you know ahead of time?
They have to let us know. Our adult clinics, we're running every other Friday for about 2 hours. We get a very small amount, mostly, not a lot of adult immunizations, but
Okay.
we do TB testing.
Yeah.
We get a
and-
lot of that with nursing students and people traveling, they want TB tests.
And just to clarify, these are not confirmed rabies cases, these are post-exposure prophylaxis, so patients who, have a bat in their house can't confirm if they were bit, or a dog bites them, can't confirm if it had rabies, so not confirmed rabies. So, thank you.
And, I know we're going to appointments only. The impact on the Amish community, that's been considered.
Actually, we have taken into consideration, we actually met with Dr. Reed today, our concern with Well Child, because I've reached out to volunteers. I can get them and then they cancel, I can't book a full clinic and then not have anyone show up, so Dr. Reed met with Adam and I. We're reassessing We are going to have a version of Well Child, but we're doing it here. One thing that I can report, since we moved to this location, the Amish, our schedule's full. They're all coming here. Before, they didn't wanna travel to 470, but for this location, like, I'm really impressed with how many it's.
Wow.
And so we have put a request in, as well to get a hitching post. When you drive in the driveway, there's that little curtain right there, there's some grassy area. I have talked with NV5, Derek, who does some of the building design, as well as Jerry Morgan, to try and get a hitching post in there. Now, obviously, some of them are probably gonna taxi in, but on the off chance
Most.
they don't, yeah, right, most. On the off chance they don't, I don't want them to get here and they have no way to tie up their buggy, and that causes a whole nother issue for them. So we'll make that available to them. So the county should be working on it and getting it up, getting that put in.
You could put a trailer hitch on your car.
Yeah.
I mean, I'll leave my truck out there, they can do
Free parking.
they can tie up.
Tie it right here.
Dr. Reed was incredibly helpful. We will try to work some way of a contract with her. So, sorry, not a contract, she'll more likely be an employee, and we'll pay her some nominal amount to help out with those clinics, at least to cover gas. But that way it also is on our insurance, because she'll be in our building doing things for us. So we'll work with that, so she can help out with these clinics.
It should be an employer or independent contractor.
Probably an employee. With an independent contractor, the insurance and everything causes a whole other issue, not to mention if we give her security access to the building, that's a whole other issue. So having her as an employee is a little easier for us, and it's a little easier pay-wise as well, to say she just works X number of hours a week, or sorry, a month, it'd be a month, and just set up that way.
So she's gonna do it here, and instead of doing it,
Correct.
Correct. We're seeing far better, I was gonna mention, as I have Carol, she right the ball with that. We're seeing far more interest in the Amish coming here than out to their location. Right. Significantly more interest. So,
wow.
shocked all of us, and we were kind of worried how we're gonna get clinics somewhere else, where we're gonna do it at, how we're gonna lug everything out there.
Well, I'm just glad that I don't disagree with going to appointment schedules. I don't disagree with that at all, but I knew from the past that the Amish can't make appointments.
All of our
Well,
clinics
they
have
do,
been by
they
appointment
call them
only.
via the community phone or whatever they have, they do call them with that, it's, from our understanding, Dr. Reed mentioned the same thing, it's just location, this is a
Yeah.
far better location than Chardon, for them specifically, yeah, so, it's interesting.
Good to know.
I'm surprised.
Right,
I am surprised. Yeah.
so, it's good for us, it's, obviously have more outreach to the community, which is gonna help us, and it'll also help the Amish community, cause Dr. Reed, like, we've seen, there's less of them getting some of their follow-up appointments, and we're seeing more of, there's things like polio that are popping back up amongst other things. So it should help us with that.
Good.
Very good, thank you.
Yeah,
Very
thank
good.
you.
And it's good that, we wanna make sure that we service all of the population of Geauga County, and
Correct.
I think the Amish are, 25 or 30% of the population, so it's pretty,
Last I
Pretty
think they're right
important.
around 30 to 33%
there you,
ballpark.
there you go.
And rising.
What's that?
Okay,
And rising.
Rising,
It's the-
correct.
Yeah.
English, right?
okay, next thing is administrative, Alta.
You guys have any questions about the report I sent?
Nope.
And Alta and I are working together, so I've asked all the directors to have the board reports to Alta and myself the Tuesday before the board meeting.
That was very nice. I
Yes.
was gonna
Nice
comment on that.
So
I
these will go out
appreciate that.
sooner. Also, these will be posted as well on the website, because these are all public records. I know in previous iterations, under, whether health commissioner it is or whoever is doing things, sometimes it's just word of mouth, like, hey, here's what we did, and you guys didn't really get a report. Or Tom had taken it and put it into one report, but we'll have these out in advance to you guys and ladies. The goal is so you can look at them, obviously like the minutes. Actually, Mayor, that's why I didn't send to you, is there was already some concerns about the minutes and some wording, so they're gonna change more than I thought they were going to.
It doesn't matter.
Okay, so
I
these
didn't
will
get
be, yes, once they change, I didn't wanna send you out, something was gonna change drastically. So these will go up on the website as well, so people can see them, and then we'll have access to them. And my goal is, now that we have this TV
Yeah.
behind us,
Yeah, there's a board meeting, or before.
more than likely
Yeah.
before, because they should be available for the public if they come in. These are public records, they can request them off the bat. So, with the TV behind us as well, my goal is to continue to put these in one big file and have them up behind us so the public can follow along with whatever's going on in the board meeting. Should they not have a copy, they bring a copy, insert whatever the issue is.
I did have one thing I wanted to add, as far as the, what I saw with the last two postings for the clerical position. First of all, we didn't get as many resumes as we usually do. Usually I have over 100, probably got 50. And of the, this time of the people that I contacted for interviews, I contacted 5 people, only 2 people responded.
And that does track with some other places too. Lake County obviously is an example. We had someone that we actually offered a job to, they said yes, and they called us last minute and said, hey, I'm not going, I found something else, better option. So,
I think it's becoming the norm. It seems like everybody's advertising for help wanted, and
yeah, it's very
they're
competitive.
getting very few applicants or whatever, so
And
it's
for
unfortunate.
those that don't know, we used to be able to say OPERS and health insurance were the reason you come to work for the health, for a government agency, not just health, but a government agency. OPERS has been systematically more or less destroyed over the years, all the benefits taken away for the most part, and it's more like a Social Security light at this point. And the health insurance, while still good, people are just getting more perks, so they're paying for college, they're paying for other trainings, things that we don't historically do because there is no financial money for that, financial reserve for that. So that is becoming more and more of a strain on that system.
Okay, so finance reports, does anybody have any questions about the finance?
I have questions about the accounts payable.
Okay,
So back in the page 4, 5, just help me understand the, for sale of property, all the refunds.
I'll kick that off to all of them. I'm gonna imagine that's just people saying they didn't wanna do it.
Yeah.
After signing
Well,
it.
That's a
they-
good
where
question.
They paid for it,
Yeah.
but their property was, not gonna transfer until, or they held off the transfer until after July 1st.
Okay.
Which was an expectation, as we mentioned in that board meeting, is there was,
Yeah.
Increase in refunds, yes.
if you don't have to pay for it, why would you?
Okay, and then the legal fees,
Those are primarily for public records requests, because I don't have a staff person on staff to
I think
redact emails.
Those are
most of it.
court fees, 'cause it's.
Oh, sorry.
Clerk of
You said-
courts.
You said legal, I
Those are
thought we
court
were talking
fees.
about.
well, it
actual
says legal fees, clerk of courts.
Yeah, those, but that's not for Brian.
No,
That's-
no,
Those
those would
are-
just be hearings.
Yeah.
Those are from, cases that we had in court, that had been closed, that they actually, have complied with. Don't hold me to this, I always get this mixed, I think it's is it agreed judgment entry first and then, no. It's the first step in the court process. I can't remember. But if they do it before there's an actual, the people have been notified, then, or,
Oh, like service?
yeah, then
Then they pull it, they
yeah.
don't go forward.
and then we're responsible. If it actually does go to court,
Uh-huh.
the people are then charged for the court fees.
Does that make sense to you, Carolyn?
Yep, yeah.
Okay.
I mean, and it often takes a while for those fees to actually
Yeah,
get billed.
years.
Yeah,
And-
exactly. So those may not be very recent cases, is my
And-
point.
And legal fee wise, we are gonna have some significant costs coming up for that, just with records redaction. One of the things I sent out to all of you, we have to deal with, that's covered with Brian, we're probably talking the tens of thousands. So just be mindful of that, we will do an increase on that probably coming up.
Can I add to the for sale property?
Mhm.
So right after the, board made the motion to end for sale property as of July 1st, we had such an influx of people paying for them, and then all of a sudden, this week, it just dried up. I've gotten one this week.
And what do you
Wow.
think that is attributed to,
I
just
think
getting the
they're-
word out?
And then people are holding off until, they did hold off until,
Yeah.
to transfer until after July 1st.
That's another reason why the O&M program needs to be up and running, because there should be some protection of the environment as well as the public in general, that, we do have people, we know they exist, I've talked to them where they haven't had their system pumped in 25 years.
Right.
I mean, that is a slick sludge, or a thick sludge that is just spewing out, and they just don't know. One guy I talked to just didn't know. He moved from another county, had never had a septic, and just, no one ever told him you got this pump. So it just, whatever is down there, it can't be great, but it's down there. So O&M will help with that. We also got some fairly good news, I think, in my opinion, and that is I talked to Chuck Walder, the county commissioner's county auditor's office, and he does believe he's gonna be able to work with us and put that on a tax assessment basis, is how it goes on. So we're not billing that in-house. We'll tell them what to bill and who to bill. That should cut significant costs out of the program, which means the fee can be where we want it to be, which is much lower than what originally it could have been.
Okay.
So we'll work with
Good.
him. When Mr. Lark comes back from vacation, him and I will try to meet with Mr. Walder, finalize it, and try to get out and running. The only snafu that possibly come up is Mr. Walder has to have all those tax, if it's on a tax assessment, it has to be done by September 30th, I believe, which is a very tight timeline, given that we don't have that program up and running yet, and the earliest we'd have the fees done would really not be till November. So
So are people's property taxes going up?
it wouldn't be the taxes, it would just be it'd be our fee just tacked onto it, and they just pay it through there. Usually cut significant costs out, because then we're not paying for credit card processing. I would guess the county auditor would probably take 1.5–2% of that fee. That's similar to what they do in other counties, is they take a small portion of it. But billing alone, we probably have to have one, if not, two clerks, I think, Alta, just for that billing. It's that large of a program, once it's fully up and running, not just this first phase. And, you figure a clerk that takes insurance, family insurance, you're probably talking $60,000 to $75,000, I'd say minimum, times
Do
two.
we currently have a program that could even support, that we could do billing?
No, this
No,
would
we
be
don't even have a
building
program.
from the ground up, people,
Right.
The software, we can use that, but again, it's not there right now. I mean, it's a monumental thing, and given that the number of septics we have in this county, it's not a small undertaking. It'll be by far the largest program in the health department.
We had one full-time clerk just for sale property, and that's, not all, it's not 30,000 septic
Right,
systems.
exactly.
Right, it's a lot. So it was good news though. I mean, it should mean that our fee, can be much lower than what it would be if we had to hire 2 full-time clerks to just do that, or 1 full-time clerk, wherever it would come out to. We don't have those numbers exactly, because it would depend on what our rollout system was, but it would have been significantly higher fee. So it should be positive.
Okay, very good. Anything else?
What's this, Clemens Nelson and Associates on page 1, is that this retainer?
That was the bane of my existence, and that is our actual final last one, the 3rd time I've said that.
That's what, I mean,
Yeah, they bill in arrear, and we had ended the contract, and they do bill in arrear, and so our time out on that was this final one.
So we'll never see another one.
No.
we're not approving
Car-
the
Car-
next financial report. If I see
Carolyn and I have
that's-
talked in detail that if I ever see that name again for that specific contract, we're gonna have a
Yeah.
problem.
Yeah.
All right.
Send the bill back if they send one.
Yeah, it's just billing in arrears.
So let's, why don't we move to approve the finance reports for July 2022 as presented? Do we have a motion?
So moved.
Do we have a second?
Second,
Roll call vote. Okay, so Ms. Brakey?
yes.
Yes.
Mrs. Roman? Dr. Jones?
Yes.
And, Pareno, yes. So that passes, okay. You wanna give a
Yeah.
administrator
Yeah.
update?
So in front of each of you, except for Carolyn, because she already has a copy, although we'll give her another copy, is the Robert's Rules of Order.
Oh, that's a big one.
Yes, you already, I do have one in case you want a different set. Those are just one's the actual book, but I would say it's like a dummies guide. It's not like 800 pages. And then there's a quick access guide, which is that foldable, kind of 3-ring binder thing. I was talking to Miss Brakey, actually, we were at the Geauga Township Association meeting, she had mentioned that she had something like that. And I thought, given some of the questions we've had recently, it's probably a good thing for everybody to have. So I got one of those for everybody, and my thought is anytime we have a new board member, this will be part of that packet they get. They might not read it the first time, but it gives them an idea of why and how and what goes on. So we'll roll that out.
And I don't know, do
Yes.
they ever offer like Robert's Rules of Order training within the county?
I did look online, there are some ones, I wanna say Summit had one, and Geauga. I didn't see anything super close to here, but I'm guessing Kent State or somebody has to have something like that. They do a bunch of different things. So my thought is, if nothing else, I haven't been to one in years, I wouldn't even mind going, so.
Yeah, I mean, I'd be interested in it because, I mean, I've not read this whole thing ever.
No, wait, what?
And I mean, there is a lot of nuances to the
There are,
rules that I
yeah.
think, could be helpful for really all of us.
I agree. It's just good information to have, if nothing else, just
Yes.
how things flow. So we'll try to work in that. My goal is to have, as I mentioned, all the board reports will be out to you pretty much a week early, if not by that that Friday would be the latest, but it would be, 5 to 7 days early. That's something we do in Lake County, and that, I think it helps. It gives more time to digest things, to look at them. The board minutes also gives you more time to look at those and say, hey, I don't agree with this is changing, this over here. So those will be out in advance, and then we'll get these put up on the website as the packet as well. That way when the community goes to look at things, they don't have to, come to me and ask me for a copy.
Yeah.
It makes it easier. And then my goal would be, we'll probably post this with the posting for the meeting, so that they have that as well before they come in. Because I can't understand where it'd be frustrating if you're sitting out in the public and someone's saying, oh yeah, look at this, whatever, and they can't see any of it.
Mhm.
That'd probably, I'd be frustrated as well if I couldn't see what you're referring to. The actual write-ups themselves for each department, we're working on maybe a better criteria for that. Right now they're kind of hodgepodge, each style. I'd like to have it more consistent amongst the divisions, but right now the goal is just to get these out in time and still process all the things that we're trying to process, and some of the changes that we're going through. I did get to go to, I got offered to go to drug court with Judge Patchke to see that process. They've asked for some, just different insight on that. That was a good experience, I think. It kind of opened up some communication between the health department and them, the health department Ravenwood, amongst some other ones. And then we also did a short presentation, about 3 hours on Saturday of last week with the Board of Mental Health. 2 of their board members were there. I was asked to go, as well as Lake Geauga Recovery Center. LGRC is usually what you see it pronounced as or shown as. And we got to talk to a lot of pastors, Casa House, a number of other people. A main concern we've seen is obviously drug use in the county. And ironically, given I'm not a pastor, I didn't see it, but the pastors have said a lot of people are overdosing or think they're overdosing, they go to church. And if I'm guessing they just assume it's a neutral space where you're not gonna get arrested, you might get help. So they actually go to the churches. So I went out there with Narcan, we gave a lot of the pastors Narcan, so they have availability of it. I asked our team here to order more Narcan, because we only have like about 48 kits on hand. And I think they're probably, had everyone that showed up was planning to, we probably would have had need for over 200 kits.
Wow.
Kane was very receptive. He's the one that oversees Narcan, that we gave so many kits away as we did. We gave away, I think, half of the 48, I wanna say, something like that. And that was with the biggest church there. I actually had to leave because I was heading up to see Magali, one of our employees, up at the square. I left to go up and see her, and they just hadn't had time to come up and get them from me yet. So I'll be meeting with them afterwards to get them some other kits. The goal is to also help the Amish. One of the questions that came up from multiple Amish bishops as well as other people was that they felt like during and after COVID, they were cut off from services from almost all the entities throughout the county. Sorry, I'm not saying all of them. Multiple entities throughout the county, yeah. I don't put words in their mouth. So this was also an opening thing with them to kind of get them, what vaccination clinics we have, what other options we have, Narcan if they need that, amongst other things. So it was a good outreach. We did schedule a second meeting, God bless you, for August 20th. The goal is to keep this rolling and keep getting people help who need it. And then we've worked some other things out with them as well to try to help them out with some other stuff. So if nothing else, instead of reinventing the wheel with 15 different agencies, we're trying to say who does what really well, let them do that. Don't have 15 people wasting the same taxpayer money doing 15 different programs, just a 1/15 of the size. So we are looking at that. They're looking at us for some help on things, we're looking for them with help on things.
Well, also, I think if we can collaborate with different agencies and we can all work together, that should hopefully be able to, well, number one, you should be able to save money, it should be a cost savings, and yet, you know, if somebody's really good at doing something, it's better to let that agency do it, so.
Absolutely.
Certainly.
Mr. Lark and I have been working as the best we can. There's honestly just been a lot of, as you guys have all seen, ladies and guys, there's been a lot of public records requests. There's been a lot of large records requests. We're prioritizing those the best we can, putting them in the order of they're received, working with Brian to redact things and he redacted, and then push out from there. We're trying to get O&M, those fees, like I said, mentioned earlier, out to you guys by next month. We'll have to talk about then. If we don't approve them next month, we'll just have to figure out what that process is gonna look like. So I'd like to have this in place by 1/1. And I want a good program. I don't wanna half-butt it just to make it go faster and then cause problems for the population, for the citizens. That's not the goal by any means. So we are looking at that, really what the fee would be. One thing Dan, Mr. Lark and I always do is anytime anyone does anything with fee-wise, what are the surrounding communities doing? So if Stark County is $10 and somehow we're 30, why are we 30? If Cuyahoga's 50 and we're 20, are we missing something? Are we not billing for something that we're incurring and we're just losing money on something? Or are we just really efficient at it? So we are looking at all those, trying to pull the other communities' numbers together, other counties, and see where we should be at. If nothing else, it's not right to the community if we're charging 50 and everybody else is charging 25, because something's wrong there. or it's subsidized somehow. That's also a possibility.
Well, that's what I was gonna say. I mean, like Cuyahoga, your property taxes are a lot higher, right?
Correct.
So.
I mean, I'm gonna assume yes. I'm not gonna say correct, but I mean,
Well, I mean,
when I was
they
up
are.
there,
I
I would
moved
say
out of
yes.
there, so
Yeah,
yeah.
I mean,
They are
Yeah.
guaranteed.
when I used to work up there, yes, we paid a significant amount in property taxes.
So, I mean, I think the fee should be in line with the cost of service.
Yes.
And, you know, however taxes fund the program, I mean, I personally would rather see a program that's more funded by fees than,
Yeah,
than raising people's taxes.
And this has to be because our taxes, our county levy is very small. It's one of the smallest in the county. I think it's the second smallest, is the last thing I'd heard. We don't bring in much of that county levy. It's 20 years old at this point, maybe a little more than 20. It's 20 years old, yeah. So it's 20 years old. It's between 5 and 650,000. I mean, it varies up and down a little bit based on collections and years and things like that. But it's not. I mean, when you look at what $500,000 or $600,000 does in today's world, it's not much. I mean, health insurance alone for a family plan is $20,000 to $25,000. You know, OPERS is 14% of every single person's every penny they make. We have to pay 14% or 14 cents into OPERS. You know, you do Medicare and everything else, workers' comp. It adds up fast. It is so. The reason why the fees are so important, when we say looking at them and make sure they're correct, we should not make money on fees in terms of like, I mean, I always look at it as a plus or minus 10%. There's a buffer zone of 10% that you're just not gonna account for everything. You're gonna have a heavy year on something and you're gonna do more than usual and you bring in more. You have years you do less and you're bringing in less, or some variation of that. O&M's a little different because it's pretty consistent. You have a set number of houses you're gonna inspect, but we can't, as an example, set the fees where we're gonna make $2 million, just a random number, and the cost is only $1 million.
Right.
We should not do that. We should be accountable to the public where if the cost of the program is $10, then the fees should add up to $10, give or take 10%, I would say, to give some buffer, because there's hiring, letting people, you know, people taking insurance that didn't have insurance, getting married, taking family insurance, having kids. Those are all flexible things that we can't change the next day, and they've got to be built into the program. But that's why this is so important. Lynn?
I agree that we need to be flat as well as possible, but how are we going to increase levy over time? We cannot continue to operate on something that was 20 years ago.
Yeah, levy wise, we have to honestly, we just go to the voters and we'd have to say, now the hard part is I did talk to Mr. Walder about this. I think I mentioned this in another meeting. We have a classified levy, not classified, sorry. Trying to think what the name it is. We have homestead rollback money though, that does not go on the normal levies in today's world. So we actually have to increase the levy to actually just generate the same revenue if we went out for a brand new levy. So you have to increase it even more above that to get additional revenue over the revenue we have now. The only thing that was brought up was, while this doesn't as a taxpayer, even though I know what the process doesn't sound great to me either, the recommendation was you'd almost have to have two levies. You'd have one where it's your current levy, and you'd have a second one, which is the increase, and that way you're not increasing more than you have to. My problem would be as I'm a taxpayer, I see two levies for the health part. That's probably all I would see, honestly. I mean, not, you know, if I don't work in a city, but the city's taxing me, I'd probably be like, why you need two levies? I wouldn't know this because they have homestead rollback and they have to increase it, so that's a tough thing.
Well, but I've seen it for other services. I've seen renewal and I've seen additional.
Right.
I think it's common. We just cannot continue to operate on something that was based 20 years ago.
And I don't disagree, I don't. The reality is that the voters have the final say, and if they decide that we should, that's why a tax internal assessment sometimes have a little more, they're a little easier to do things with, but it's harder on the communities. So there's pros and cons to everything.
Well-
And I think one of the gentlemen actually at the HDAC had mentioned, he felt like they abdicated their responsibility by going to a levy because it meant that we in essence just had to restrict or reduce what we do, and what that does is kind of like now when someone says, hey, I want my septic inspected tomorrow, and we have to say no, sometimes we don't have the people, and we don't have the money to pay them more, and then our fees are already rather high, as a gentleman mentioned last time, and as Mr. Larkin and I talked to you about. So those all play in, they all play a role. It's not, you know, all those little dots are interconnected, as one dot falls off, one has to pick it up. So I don't disagree, Linda, at all.
No, we have to figure out how to communicate to the public that we cannot continue to live on the same budget we had 20 years ago. So we
Yeah.
gotta come up with something, okay.
Yeah, so we are working on that. We'll bring O&M to everyone, hopefully next month, that's my goal. You know, it's in pencil at this point, that's the goal. We'll also bring some other fees more than likely to you next meeting as well. Mr. Larkin, we have a lot on the plate, but we're trying to get through all of it and make sure it's correct, because that's the most important thing. You know, if I give you crappy numbers, it doesn't help you one bit. You know, they gotta be reasonable numbers. Besides that, obviously we're in the new building. This will likely be our new meeting space. The county commissioners do have their area, which I had thought about trying to use, but it is locked and we don't have access to it. I'm not saying we couldn't get access, but it's not ideal to be borrowing their space. And right now there's only, I think cleaning's what, two days a week right now is what they had said. Maintenance is down, significant number of people. I talked to Glenn actually recently, he's the supervisor of the maintenance team. They can't find people to work for they're paying like $19.41 an hour. They cannot find people to work. So right now, if someone does come through the building, there are times where we have to say, excuse our mess, things just aren't getting picked up, we do it ourselves. I bought a vacuum for us so we can vacuum our own spaces. The bathrooms are tougher because obviously,
Should get a raise from that.
you know,
No, but I've been doing a lot of cleaning.
yeah.
Emptying trash.
What tends to happen is one of us from the director team picks it up, because obviously if an hourly staff does it, we have to pay them. So instead, one of us just picks it up and, you know, picks up the garbage, takes it out, vacuums. It's not the best use of that person's time, but it is the best use that I have at the moment.
Yeah.
And it's no one's fault, it's just the competitive market right now where Glenn can't keep people, and God bless him because he is working his butt off to get people, he just can't keep them. The space in here in general, this will probably be the general layout. The only really tough factor is that, like, I'm gonna use HDAC as an example, the Health District Advisory Council. That is 40 or 50 people ballpark with us included and everybody else. More than likely we'll have to stretch this way. The room is not designed that way. As you can see, there's the electrical ports in the ground, or sorry, the floor. They're meant for these tables to run this way, not this way. The annoying part is that the projector screen is right there, the projector's there, so the projector actually projects that direction. You can use the TV, but then nobody around that corner can see what the TV is showing. Now I think, yes, design problem. I think, from my understanding, we can get these TVs linked together. We just have to figure out how to do it, because IT, I actually went out to Walmart and bought our 25-foot HDMI cable because none of this is actually set up yet to run. So this TV is actually registered in my Samsung account that I had to create today to make it even run. But it's running, and IT hasn't been bending over backwards for us, I will say that. They've been fixing every problem we have, like, on the spot, which has been fantastic. Frank Antonucci and his team, Andy, Zach, Michael, we call him Supreme Overlord. He's with somebody else.
Oh, okay.
Although you're great too, sir. You are fantastic.
Yourself
Not
on
to
camera,
discount him.
sir. Yeah.
So there are small kinks working out. Kevin from maintenance, God bless his soul, today actually fixed our door, I believe. because the doors actually would not close. One door either swelled or was off kilter, and we actually had someone today who walked into our area because the door was unlocked, trying to find something else. And of course, with us having HIPAA documents out, that is not ideal. So luckily, they were in an area that didn't impact it. We were able to fix that. I did hang up signs saying "Do not enter," it's restricted, and then Kevin was able to fix that, which is phenomenal because it was actually a pretty big issue that we had. That could have been an issue.
Yeah.
It could have been.
Well, next time you use this room, could you push these tables out a bit so we can,
You feel
See
proud of
what's
it.
behind us.
so we can,
Yeah.
we can turn around and say the pledge?
Yeah, they actually set this room up for us, and so I didn't move it too much more than what they had it for. But yeah, we can ask them to move this out a bit.
Yeah, there you go.
Besides that, I am probably, as strange as it sounds, I'm probably gonna get one of those mini microphone speaker boxes, like a karaoke machine. We'll use that because there still is not a microphone for this room, and that is not conducive for someone speaking if you guys can't hear them or if they can't hear you. We do need one anyways for some of our external events, so it's a dual. I'm not just buying it to buy to a karaoke machine. We'll actually use it for external events like at the fair and other things. So we will need that, and they're relatively low cost. They're $100, $200. So we'll be getting one of
How are you
those.
gonna use it at the fair, Adam?
What's that?
How are you going to use it at the fair?
Oh, I'm gonna karaoke my heart. I'm just kidding. I can't sing.
You're just gonna yell at people that
yes.
can't get their blood pressure.
Are you stressed?
It's a
Mostly from me
negative.
yelling. No, we have a couple events that Magali does, Rios, that she does safe community events and other things that we could probably use that for, and it would be ideal to have one. She actually mentioned she wanted one. I said, ironically, I need to get one anyways. So we'll probably do something like that. So we'll get one. I went to look at them today, but they only had wired ones, and I don't want to have a wired remote speaker because that just doesn't make any sense. Besides that, we are almost done with the community health needs assessment. We worked with UH on that, as well as a company called Conduit. We got a good deal because we partnered with Lake County to both use the same company, and it cut our fee down a good chunk of change. It's still incredibly expensive. It is. We have to do it though for accreditation. We don't have a choice. Not that's not good for the community. It's just it's an expensive endeavor. We did most of the work. Hopefully UH isn't listening, but we did a lot of the work. So we have one last Amish focus group to handle, and that is pretty much it. So we have to do one last Amish focus group. UH has been nothing but short of amazing as well. They've done some of the background work for us. They've helped pay for half the program for us. They need it as well. So, tongue in cheek, but UH has done a lot to help us. So
When
it's
do
been
you
a good
expect
partnership.
that we will have
Uh,
a report out?
Was it end of September I think it was end of September.
Okay.
Yeah, sorry, there was like 4 dates that we had other things to do, but I think end of September is the date to have a draft copy, and then we push it out after that. The hospital, if I remember correctly, has to do it every 3 years, so we'll be on the 3-year cycle like we are now, doing that.
So in October, we could expect.
Hopefully by then we'll have some kind of a draft one. Yeah, we have an initial draft now to some degree, but it's not, we have to do some logo work.
Right.
We're also looking at, for the health department, do we use the countrywide public health logo, which is the 3 crossroads, prevent, promote, and protect, which everybody else uses, versus the maple leaf on the water. There's some discussion, do we go with that? It's a little more standardized. There's reasons that we would do that. So there's some discussion we're having about that as to what we use with that. We're also revamping the website. As everybody's aware, we are deep into that process. Magali has, Rios again, Sarah, Carol, they've been working a lot on that to try to roll that out. We're trying to reduce the number of pages because if you've been on our website, there's a page for everything. These pages go like 800 links deep. And the reality is most of us, myself, probably don't go much more than 2. I think the national average is like 2 or 3 is the deepest anybody clicks. After that, most of them are gone. So we're working on that. We're also going to revamp it for more like a modern feel. Vital stats will be up in the front. The EH forms will be up on the front. Quick access links to a lot of things. We'll also it'll be on a WordPress site, which is much more user friendly. It's what most of them are built on nowadays, and Magali can change that stuff pretty easily in-house. I know it's a lot. There's been a lot.
Company 119?
Yes, that's what we're using.
Okay.
They've been fantastic. Frank Antonucci and his team from ADP have been awesome with that as well. I know I keep rambling on. There's actually been a lot the past month between Alta's team up front, Carol's team, Dan Larkin's team. There's been a lot. They've tackled a lot of different things that probably no one will ever even see, but they've been doing. Alta's team has been processing people as fast as they come in, which has been fantastic. I've heard almost 0 complaints in general, besides one frustrated individual that we talked with and worked things out for the most part. But in general, things have been going significantly better across the board. So that's been fantastic to see and hear. And then Dr. Cameron has been coming in graciously and making sure he's updated and he updates us, and that's been working out as well. We talked to Dr. Reed today as well about some things. So it's a lot. The team here is doing, you know, I get to tell you all about it, but they're doing all the actual work, and they're doing phenomenal stuff. So we will be at the fair. That's coming up relatively quickly. We'll have a booth there. We're also looking at doing the parade as well. Probably taking one of the GPH Jeeps out, you know, handing candy out to kids, things like that. Super healthy stuff, you know. Throw a banana at them or something. No, we'll do candy or something like that. It's a good community thing. Obviously, the parade will be there. So,
Yeah, just let us know how we can support you guys.
you want a baby
on that.
carrot? I don't want carrots. No, so yeah, so we'll let you know what it's going to look like. We're kind of modeling it after kind of we do in Lake County. We did actually their parade last night. We have a big vaccination bus that we take out to more rural counties and communities, or sorry, not counties, communities that maybe can't travel to Mentor, don't want to travel to Mentor. And it usually works out pretty well. We talk to people about different things, usually rabies and septics and things like that. But it works out really well. Usually like those, like the Mott's gummy snacks, the healthier the gummy snacks, we call it that, right? And then some like, right, yeah, and then some beads or something like that, and the kids and the parents love it. So it's just,
Cool.
you know, good chance for us to be out there.
Yeah. Attract the kids and the parents will come along,
Right.
right?
That's what we
As long as they're all having fun.
Another thing I think you wanna talk about, typically the ORC requires us to have, I call it continuing education
they
because
see
I'm
you.
licensed, but 1 hour, I think, minimum of 2 hours minimum of continuing education. So Adam and I were talking about that, and I mean, basically, you wanna talk about what can be continuing education?
Yeah, so my goal is to have, so this is back, I think Bob Wisdak was here at this point. We did one like septic systems, give the board an understanding of what septics are. We'll have a staff member come in, kind of explain what they do. So we'll probably do a septic system one. We'll probably have Carol do one with some vaccine type stuff, just general vaccination things, so like what we do, how we do it, maybe TB testing, things of that nature. We'll probably do something like private wells and water, maybe campgrounds, House Bill 110. The reality is, as much as we have other things in the health district, the majority of what we do is environmental health. So you'll probably get updates mostly on environmental health, campgrounds and things like that. We'll probably also do something with rabies, because that's a hot topic issue nowadays. Not issue, but just a common discussion point amongst people, as you know, rabies. And it's also actually a very interesting program, honestly, with what they have to do with the spinal fluid, the brain fluid, and things like that. It's actually very interesting. So we'll start doing that. I'm hoping maybe like 15 or 20 minutes, half an hour tops. Usually with questions, they go a half an hour. So we'll probably do 4 of them, and that would cover all the stuff we have to cover. And then we'll try to set up once a quarter next year would be just a consistent thing of every quarter, just expect every training.
And when do you wanna do these?
We'll probably try to start August or September. I'd like to start next month. And honestly, O&M would probably count for that.
At
board,
these meetings,
they're
or-
board meetings, yes, they're board meetings. They're not outside of that. My experience with doing these, including here, is that when I do them outside of here, people don't do them. We had one, I can't remember who it was, 3 or 4 years ago, Alt and I had to send out multiple requests to complete her continuing education, and it was a nightmare to try to get. So they're usually done in here. That's usually typical for most Board of Health, though, is they do them in here. It gives the public a chance also to hear those programs and to see how they go in, what they do, things of that nature.
Well, they have to be it's an open meeting.
Yeah, it's just, if you did them private, not actually private, but if we send them out to you individually and said, hey, just sign off, you did this, like,
Yeah.
review, watch a video,
Yeah.
the public would never get to see, like, you know, why do septics have to be inspected? Why do, I never heard of rabies, why do we have to have rabies stuff? You know, they get to have more of an in-depth look at that. It also keeps us all accountable that we actually kept our eyes open throughout the training and got it. So a little accountability is never a bad thing. The last thing I really had is this afternoon, Patty let us know that she was not gonna be at this meeting. She had some family stuff going on. She also said she is going to resign from the board just due to she just can't give 100% right now. So she did communicate with Rich. We'll have a formal letter in the future. short of anything changing, but it sounds like that is her final decision. So I'll have to work with just seeing what we're gonna do with that. I mean, there's not another HDAC appointment until March, and my fear is, you start, 2 people can't show up, now you don't have a quorum. And that's,
Well, then we need to have a medical, well, I guess Ashley would count, would Ashley count?
I
as a
actually have to
medical
look into if she
professional?
counts or not, because
Yeah.
I'm used to hearing veterinarian or equivalency.
Yeah.
Usually the lowest
Yeah.
is a veterinarian. I've gotta see if you count or not, which I just don't know off the top of my head,
I was
honestly.
gonna say, I think any medical doctoral does,
Yeah.
somewhere in the verbiage, but yeah, please check and let me
Yeah,
know.
I told Rich, I do believe you count,
So
but
you
I,
think you do come?
Based on what I've read previously, when we were looking at other people applying, obviously for like the commissioner positions, and the wording and the actual code does say doctoral equivalent, but because the ones that were later put in, such as Pharm D, cause it used to just be a master's program.
Mhm.
And so, once that
Oh.
changed, so it's doctoral.
Okay.
well, and the health commissioner one is separate from the one for the
Yeah.
Board of Health.
Yeah.
So I've gotta
That's
look at
why
the Board
I'm
of
not
Health.
sure, because I know I've
Yeah,
looked at
I-
that, but
Yeah,
I
I
don't
know
know
I've
the
read it.
specifics.
But I think we'll be okay with Ashley, but we should definitely review, because I know we
Yeah.
do need to have one quote-unquote doctor.
Right.
Yeah, I
And-
think
and
we need a
honest-
plan regardless.
Yeah, and honestly, it's, so drawing from experience from Lake, we've, since before I've been there, he's under 25 years, we've had a vet on there as well. He always could serve as a backup. He was always there as a vet
Right, I
counts.
kinda see myself as a secondary to
Yeah.
Patty, obviously, and Dr. Cameron too, but we can't use you for a board member and a
Right.
commissioner,
So given that I just don't have any experience with
Yeah.
that specific thing relatively recently, all I have to do is pull it up and look at your license, see what qualifies. If it
Yeah.
does, it does. If it doesn't, we have to have that very specific requirement.
Mhm.
And we do have some grace time, but I don't wanna use 6 months or 8 months, which would be March. I mean, I think that's a
Yeah.
lot
So I was
of,
gonna ask, can we request an earlier HDAC meeting to fill the position?
my understanding is, yes, I think we did a long time, like
Yeah.
years ago, like, what, 5, 6 years ago, I think it was when Winbrand left, I think.
Yeah, I think Winbrand was placed, wasn't he placed and then he left and then somebody else came in and they
Yeah.
left. and-
I wanna say it was 5 or 6 years ago. It was,
Yeah.
I had just started, I mean, I was here maybe a year when that whole thing unrolled, so we could ask that.
It was less than 5 years ago.
Less than 5, so I just wanna start that process, cause if we do have to do it, and either way, we don't have a large board, so if 2 people can't show up, we can't have
I think we need a plan
you know.
regardless.
Yeah, I think so too.
Like, I'm
Yeah.
pretty
Yeah.
sure my credentials count, but I still think it's best to have, we need the breadth and depth of experiences on the board, so
Yeah.
if we're a member short, we should still seek what our options are.
Yeah.
Yeah,
I agree.
and I do wanna, for the public that's here, but obviously just the board, I know one concern we had last time when a board member was appointed was that they weren't a medical professional or medical related professional. From my understanding, boards of health, and how it's been many years, many times, is that they're supposed to be a dynamic of the community. So you're not supposed to have just 5 doctors, or just 5, I use lawyers as an example, 'cause you got not just lawyers, not just realtors, not just whatever, and you're not supposed to have everyone making $500,000 a year on the board either. You're supposed to have
We need community members.
right, it's supposed to resemble your community.
Absolutely.
So,
Yeah, the
it's,
part of the code that talks about the HDAC, they even say that it should be from different parts of the county, so, that you shouldn't even be from the same, so
Yeah.
geographically, you should come from different part of the
Yeah,
county.
so-
I thought that was kind of interesting.
so we have different contracts, Lake and Geauga. Lake, as an example, every community gets 1 member if they're a city. The largest city gets 2, so Mentor gets 2. And then townships and villages make up the HDAC. So townships and villages, they vote on the appointments, and then the cities actually make up the board with some other appointments based on that, like the HDAC appoints their own board
But
members.
the lake board is much larger.
Oh, it's 14
Yeah,
people,
I was gonna
it's
say,
huge.
that's
But,
versus-
but same mentality though, I think was what I was getting to, is like Carolyn was saying, it's supposed to make up different sections. You don't just wanna have every single person, let's say Mentor sample, or just from Chardon,
Yeah.
because it doesn't make up the community that way.
Yeah.
It's not making up Burton, it's not making up Middlefield, it's not somewhere else. So that'd be something we'd have to talk about as well in terms of, that aspect of it.
Yeah.
So, I don't know, long-winded to say the least, but that, there's been a lot. It's been a whirlwind the past 3 weeks, 4 weeks.
So, in our bylaws, we have bylaws back from a couple of 2 commissioners ago, 3 commissioners ago.
2.
And then we have bylaws from 2 commissioners ago or whatever. So anyway, I have copies of those, and I think what we should do is, we revised the bylaws, I think a year or 2 ago, to allow committees, and we should probably establish a bylaw committee to review these, to make sure they're up to date. And, because actually even the two different bylaws contradict each other, so.
I think,
Weren't the bylaws modified when Tom Quaid was here?
Yes, they
Okay.
were,
So that was 2 years ago.
yes.
so we should establish a process, whether it's, triennial review or however often, so it's a standardized process, not just when
Yes.
somebody comes and goes, but that it's a consistent review. So the process itself we need to determine,
I
but
mean,
I think they need to be reviewed, certainly.
And I think ideally if the board's up for it, because some years it might just be a write-off that nothing has really changed since last time, it wouldn't hurt to do a yearly review.
Yeah.
I
it should
I
be a
highly,
review.
I
Yeah,
recommend we
standardized
review them
review.
yearly.
Because if we don't, what I tend to see is when you don't do yearly, it just kinda, I don't remember how we did it, I
Right,
don't remember that,
right.
and
And we
we'll
forget
wait
what they
again,
said, yeah.
right?
I just
It's-
use triennial, for example, in
Yeah,
the
no,
policies,
yeah.
but I think they do deserve a
Yeah, I
standardized
sit
review
on another
process.
board and we use a 5-year mark, and it turns out it's been changed twice within the 5 years, so.
Yeah,
I
The
think
point
most
is
times-
that there was nothing there before, and if the bylaw, does the bylaws, I can't remember, have a requirement in, if not,
well,
The-
we,
the bylaws should now.
Commissioner Quaid eliminated the committees, and then I figured that out, and we revised the bylaws to include the committees. So
Okay.
right now,
But do we have a clause in the bylaws that says the bylaws should be reviewed
No.
I don't think so, that's
No,
my point,
no.
yeah.
Yeah, so
and
we.
you know, they're only like 3 pages, there's not too
Yeah,
many
they're not.
pages.
That's why I figured if we did it yearly, like say, let's say every
Yeah.
October, I'm just random date, but if we
Yeah.
did set month, it might
Right.
be an easy thing the board can just knock out. I mean, I doubt there's gonna be changes more than every couple of years. I mean, I think every 5 years, honestly, they could probably go, every 3 years,
In
and you
some
probably never see an
cases.
adjustment.
Right,
But at least this way,
I
it's
think
like, it's a
annually is
consistent
good.
thing.
Yeah, and when you have turnover with board members getting appointed and things like that, I think
Right.
it's good for everybody to lay eyes on them.
Mhm.
But I volunteer for that committee. I already redlined them when I read through them after I was
Yeah.
appointed, so.
And I would volunteer for that committee, having
Okay.
helped organizations with bylaws.
so basically, so everybody knows, we really can only have 2 people on from the board on the committee.
Yeah, it's
And the
unique.
committee
It's a
will
quorum
be,
So there was a quorum, yeah.
yeah,
The committees are public, they're public meetings.
it's a public meeting.
There's no public comment, so they can't comment unless you allow them to, but they can sit in and listen to
The
the
meeting.
committee. The committee still brings it to the board though, and then says whatever you've decided,
For final.
nothing, something,
Right.
whatever.
And so, okay, so then Carolyn and Lynn, and then it'll be up to you guys to figure out when you'd like to have
Yeah.
a meeting or whatever.
You'd really
and
have to
then
communicate
coordinate
with,
that one.
communicate that with Alta and myself, and then
Okay.
she can set up to post
Got
it
it.
and everything.
And you should be there.
Yeah, I'll be there, just so
Okay.
we're on the same page.
And then the other, is it time for a O&M committee? Or, do you have feelings on that, or?
I mean, I would say, given how large O&M is, I would prefer, as much as the pay and budget's gonna be, I'd prefer to do that in open session, because I think the last time with like for sale property, that just didn't really work out.
Okay.
I
So,
think there's a lot of questions that we need to have it in open session, so people have the opportunity to hear about it, but also ask.
yeah, and it's,
So it should be a dedicated.
yeah, and maybe it's just one extra board meeting on that month.
On the
Like,
month.
we
Yeah,
meet
like
one
a
extra
special
time,
meeting.
meet at least 3 people.
Mhm.
You gotta post the committee anyways, it's just,
Right.
there were so many questions last time, I think we pretty much rehashed the entire committee, honestly. I mean, I think
Okay.
we spent an
Yeah.
hour doing what the committee did.
Okay,
So it might be better to do that, and then go from there.
okay.
And those honestly, I mean, I'm not sure how long those meetings will go, to be up to the board. If you guys have if there's a bunch of questions or a bunch of work being done, it might go 2 hours. If there's just, oh yeah, we agree, it might be 20 minutes. It'll really depend on what the situation is.
Okay, so next thing is new business. Now, this contract amendment,
Oh, can I ask one more quick question on
Sure.
the administrator? So Adam, have there been any communication with schools, like the school superintendents?
Yes, actually, I met with them, yeah, it was 2-3 weeks ago. We actually got a plaque, a thank you, not plaque, like a resolution of appreciation that we got from the superintendents actually for Lake and Geauga. We each got our own. We've been communicating. There's actually, I'm working with Health Commissioner Graham in Lake County to put a post out. I don't know who started it. I couldn't tell you, but apparently both superintendents groups, which actually meet together, which is why we tend to do it as a unit, have been hearing that there was gonna be masks, mandates, or requirements, or whatever. I mean, insert whatever.
Something with
The words were all over the place on what the wording was. We aren't doing that. I mean, you know.
Or not.
Are not. I mean, short of you as a board deciding we are, I have no intention of doing that. So that would be a, Mr. Graham and I are looking, or Commissioner Graham and I are looking to do some kind of a social media post, website post, whatever, that would announce, just saying, you know, A, we don't have the authority to mandate, B, we're not mandating. It would be up to each school or community, however they source, I mean, because there's private schools as well, those are different than, you know, just the community. It would be up to them to decide what they wanna do, but that, we're not, our dog is not in that fight, you know, other than just, if they need vaccines, we'll help them, if they need clinics, we'll help them, if they have questions, we have no problem helping them, but to my
Are
knowledge.
the private schools under the ESC, the count, or no?
I don't know if they're
Only
under
public?
them, they do meet sometimes with them, they're oftentimes not included, they're oftentimes not there to some degree.
Okay.
Mostly they reach out to Carol and I had most of them on speed dial where they would just call us up and say, hey, you know, we had X, Y, Z, and I'd run test kits out to them, I'd run out and answer questions for them, we'd meet with them. And I've always told everyone in this county, same in Lake County, if you need something, just call me. That's the fastest way to get something done, is just to call me, don't hesitate, and then we can set up a meeting and knock it out. Because emails tend to go back and forth forever, and then no one really understands what's going on. It's a lot easier to meet and say, what are your needs, how do we help you, and what can we do that's safe and reliable, and we go from there. So I think we've excelled at that, in my personal opinion, between Carol, Alta and her team, Dan Lark. I think we've been excelling at that, with being open and honest with the public and communicating what we need to. The monkeypox thing, we'll figure that out as it goes. That's gonna be a whole nother.
And
That's
the
different.
ODH call today too for the directors, they did bring out that, ODH does not plan to change any school guidelines or anything right now. It is kinda gonna be put on the schools as to what they do, if ODH is following CDC, and if CDC rolls something out, then ODH will look at it to see if it's something that they will, actually incorporate or recommend. But right now, with the start of the school year, there was a lot of questions today about that. There's a lot of parents like, what are we doing with this or whatever, and ODH is like, we're just leaving it where it was, and it's gonna be up to the schools.
And obviously, we'll bring to all of you whatever, if we're doing something, you'll know about it. I mean, at worst, I'll send you an email update. If there's not a board meeting coming up, and say, hey, here's what we're looking at, call me if you have questions. But I don't, you know, short of something catastrophic happening, I don't see our place being that. We'll answer their questions, but the schools need to do what the schools do. And their boards know, I mean, I've met with almost all the boards in this county, the school boards I've met with them, or been available to them for the public ones. The private ones, it's usually like a president or a dean. I've been out to NDCL, I've been out to St. Helens, been out to all of them. So we meet with all of them whenever they need something, so it should work out to the best of our ability.
So no mandates, but obviously, but also no guidelines for schools, is that correct?
No new guidelines.
No.
They're
So
going-
what are the current there are current
Well,
guidelines?
they're doing the,
We have,
They're driven from.
yeah, we have the ODH one still on our
Okay,
website,
they're not
which is,
GPHs though.
no, because we adopted.
we did ODHs.
We followed ODH, and ODH is following CDC, is what
So
we
we
did.
just
It's
linked
the
it up
mask,
directly?
We pretty much,
the
it's
mask
on our
to
letterhead, it's the
play,
same thing.
test to stay.
That's still
something.
around?
They still
Mm.
have that around. ODH has not revamped that.
No.
Now, that's up to the schools. I think the schools can change that. Obviously, they can
To
alter that and
implement
have
it
their
or
own
not
plan.
implement it.
That's just a recommendation.
We provide it as a link, because usually what they do is, I'm not sure if it's their legal or if it's however much, the first thing they usually ask is, what is ODH and CDC's guidelines? That's the first thing they ask. We then say, here's a link, it's on the page, third box down, there's a link. We then try to work with them with what their reality is. Because the reality and what is written sometimes, those don't always mesh together. And we try to make it doable. So we work with them the best we can.
So just to clarify, so I understand that ODH has their guidelines,
Mhm.
and then prior to me joining the board put out, or GPH put out its own guidelines. Those are not currently in place, correct?
They're more or less carbon copy of
Carbon
ODH and
copy.
CDC.
Yeah.
And-
We followed
But
ODH.
they
Well,
weren't-
I
they
think I
weren't
know
ever
what you're
required,
referring to though, when we had Dr. Reed as the interim commissioner
Mhm. Yeah.
and they presented the discussion for the quarantine and the masking, is that what you're referring
Yes.
to?
Yeah.
But I don't know that,
That's
But that's off the website, that's not
Yeah.
correct,
That's been
correct.
long gone.
Yeah,
Okay.
that's
Right,
It's just-
That's what I was just clarify.
Yeah, it's just-
So you have the links to the ODH.
Yeah, it's on our letterhead, because we obviously put out on our letterhead, but it's ODH and CDC.
I think that's the best from a liability standpoint, because if they update their information constantly and we post anything on ours and it doesn't match, it's not right.
Yeah.
Right.
So,
And I think we just continually need to stress that these are recommendations. It's not, we're not mandating, we don't have the power to mandate, we don't have the power to tell someone, I mean, it's not within.
But the way the schools were treating it, I mean, you guys were kind of pointing your finger at the schools and the schools were pointing, you know what I mean? This is what was going on.
Yeah.
I agree, and I mean, to a degree, I do agree, but the schools, it is up to them to make their own guidelines,
Right.
what they're opting to
But they
choose.
are too, if you set a guide, I mean, I don't wanna get into this rabbit hole too much, but if you set a guideline, that's a best practice and they can set themselves up for liability if they stray from that best practice. So if we put out guidelines, I mean, we can't say, oh, these guidelines.
yeah,
You know, there's real impact about that with families and children.
and I think it's best for us just to not serve as the middleman and provide the link.
That's,
and that way they
I mean,
have
that's my
direct-
point. I don't think
yeah.
GPH should be putting out any independent guidelines at all.
Yeah, the only
And I
time we,
think we
we have-
definitely learned
Okay,
from that
so
experience.
everyone has to meet about that.
yeah, the only time we put out really independent, like differentiating was
Was-
when we were looser than ODH was. Because we could be looser, but if there was still a default with a number of people, they still defaulted ODH because they went with the national standard. So the schools, yeah, they did point some fingers, but they usually generally went back to ODH and CDC's guidelines.
Yeah.
That's, because that is what you do. I mean, it's the same thing we do. You know, here at the health department, we don't just say, okay, well, we're gonna do this. It's what are the national standards? And we follow those. We can help them beyond that, but the standards are still the standards. Yeah.
Okay,
Anything else, Adam?
can we,
I don't think so.
so can we move on to, new business, the contract amendment, do you have that contract?
I don't have I think, did you give them, or do you have a copy from the sign? All right, we'll do a resolution to approve it. The contract is a set hourly rate for, there's two Lake County staff that are helping out with where we had shortcomings. So one of them was training the new vital stats registrar, and the other person is assisting Dan Lark with getting the the for sale property stuff settled out, as well as the camps issue that we had, with the state audit, on top of House Bill 110. So we had, there were some staff in Lake County that were available for a limited time, in essence, to help train with those things and get us back up and running. Cause the camp issue, if you guys remember that one, that had a very short timeline.
Right.
And we honestly didn't have the staffing to deal with that as well. So we were able to work out
So this is a revised
revision, yeah.
for those two people, and you're
Correct.
okay with what it says, cause we don't know.
Yeah, well, you had a copy of it, cause that went to you, cause I can't negotiate that, obviously, cause of conflict of interest.
I didn't go find it too.
It was just a flat hourly rate though.
Okay.
It's just
I
a
did
flat
say
hourly
it was,
rate.
yeah, it was accepted. It
Because
was
we didn't put a
similar.
title in there because
Right,
that would, if you need something else, then you can't use it for something else. I have to say no, we have to go back to the board and ask for a different revision to help with a different area. The goal is to minimize those and then wean off of any of those additional staff, but they're put in there as additional hours in case we need them. We've been using them minimally. Right now, we have Gina Parker, who's helping with vital stats. We have Marianne Rusnak, who's helping with vital stats and environmental health. And we have Paul Stronk, who's helping with the camp inspections, which we're behind. So it's minimal at best, just in essence to help out. And those
What's
staff will come
minimal
back.
in terms of time or hours?
I'll pull up the hours and give it to you. Dan, I actually just got an email with those hours.
So we're not approving that tonight then, I assume.
Sorry, what's that?
So we're not approving that tonight then, if we don't have this information?
I can print out, I can go get the contracts. I don't,
no. Can we table it now?
Do you need it approved,
Yeah.
new business?
ideally, yes, cause we're at a hard pinch right now. The only reason that we have that staff in here already is because vital stats couldn't have been up and running.
Sorry,
Okay.
it's a new phone, I don't know.
So,
Mary Ravenwood Alta, can you print out a copy of the contract? The one that I sent you? I just don't have a printed copy with me.
you got it in there?
No, I don't have, 'cause I turned everything off so that you don't see much pop-ups on there.
Okay.
We'll get over you guys. It's the same contract, Mr. Lark, with an hourly rate. That's all it was.
So
It
we-
did go through legal as well. Everything goes through legal. They
Okay.
then approve it. The main issue being that I can only ask Lake County to front staff for so long without being
Yeah.
paid.
And I do recall, I know I gave the, I mean, I was accepting of, you know, we needed more people, if they were available to certainly take them, because we are very behind, so.
Right.
Yeah.
No, I
so
don't
we
disagree with
can-
that, I just don't,
I don't wanna prove
We
something
can,
without seeing
yeah,
it.
so we can move that down, yeah, at the end, okay, if Alta can get that.
That's all right.
to us.
I tend to keep my hands out of that entirely, just 'cause I don't want
Yeah.
anyone saying,
Yeah.
I
Bring it
adjusted
back.
it, I modified
Bring
it,
it-
I'm hands off on that, even with the prosecutor, that goes directly with
bring it
somebody else.
back after executive session.
Yeah.
Oh, good idea.
Okay, so the next thing is move,
We do have new business for the, it was the walk-on, it was the, oh yeah, appropriation, sorry, yeah. It's not on the one I had.
so move to adapt resolution 2022-8, appointing Joel Weiss as registrar effective July 28th, 2022. We have a motion. We have a second.
Second.
Okay.
Who moved?
Who
I
moved?
didn't hear who moved.
Nobody did.
Yeah,
Oh.
I don't think I didn't hear anybody, so I'll
So-
move.
Oh, she
I
moved.
I have a stupid question maybe,
Yeah.
I don't ever remember having to have a resolution when we've hired other people.
We don't registrar specific,
It's
you have to
state.
send something down to the state saying you have one.
For vital
All right.
statistics.
Okay, thank you.
And who seconded, I'm sorry.
I
Well,
don't
now we
think-
need a second.
Who was the first?
I'm
Ashley.
first, so moved.
I'll
Moved.
second.
And that was my call. So then you want a roll call vote, so, Mrs. Brakey,
Yes.
Mrs. Roman,
Yes.
Mrs. Jones.
Yes.
And Moreno, yes, okay. So, we're gonna do, the next one is a supplemental appropriation. Move to approve the supplemental appropriation as presented.
And that's something Carolyn was going through the funds today, looking at where we might be short by year end, and these were some of the areas that were semi-short, and I figured it would be better to walk it on today than wait another month, with some of them being, they're somewhat close.
So do we have a motion?
Motion.
Go ahead.
So we have a
Let me go back.
motion?
Motion to approve the supplemental appropriations as presented.
Okay, do we have a second?
Second.
Okay. So, roll call vote, Mrs. Brakey,
Yes.
Mrs. Roman.
Yes.
Mrs. Jones.
Yes.
And Moreno, yes, so that passes, okay.
And for those that don't know, the appropriations are just the authority to spend, it's not actually spending that money, just so we're all on the same page. You know, appropriations kinda get, it's not a typical word used elsewhere.
Okay,
So we move the money around to these accounts too.
There is, no, the money's already there, it's just the ability to spend said money. And if we don't spend it, if we don't spend it or don't think we have, we reduce it, but those are areas that are likely going to be spent, that area. And public comment would be next.
okay, so the next on our agenda is public comment. Basically, we should have no problem with how long the session should last, 20 minutes should be sufficient. Generally, we give 2 minutes per speaker to make comments and ask questions. Sometimes the board can answer the question, but other times we need opportunity to investigate the responses following the meeting. This is, so we may not be able to respond right away. Board responses will be recorded and publicly filed with meeting minutes. So, I guess we can start with, please say your name and your address. So you wanna start with, which one of you in the front wants to go first?
You and voters,
Miss-
as I'm always told, you don't comment, right?
Just
Shelley always tells me we don't comment.
Okay.
We're just gonna
Mira-
hit start when they come up. I just use the restroom. You just hit
Okay.
start. It'll count down up here. It's a whole lot better.
You might wanna hear mine.
Okay, can we take a 2-minute?
Somebody else can go before me. You go.
I just
wanna
use the
see you
restroom
do
very
an
quickly.
accident. But if it doesn't count, what's the registrar do?
Pardon me?
Joe Weiss, what is that?
Okay,
Joanne.
registrar is, Alta, you know the answer to that?
Joelle, she's our vital statistics. She issues, death and birth certificates for the county,
Yeah,
all deaths and birth certificates.
so what is Joe?
Joelle, she is the registrar, so
Joe-
she does that and she
so it's-
files them.
So it's not Joe Weiss, the attorney?
No, I'm
No.
sorry, Joelle.
Joelle.
Her name is Joelle.
And
Yeah.
She
Rich
was actually a
said
part
Joel.
of the admin team and then applied for, when we had an opening, applied for the position, but she's been with GPH for a little bit. She worked under Alta.
I just didn't know what it was.
Yeah.
So does somebody else wanna speak in the back? Anybody? While we're waiting for Adam?
Vicky.
Good evening, everyone. I just need some clarification.
I'm sorry, your name and?
Vicky List. You don't know me by now?
I know you, but, and where do you live, Vicki?
I live on Taylor Wells Road.
Okay.
You're
go
closer to me
ahead.
here,
Right, I know, just.
and you're
how-
actually closer to the Amish, that's why they're coming here. Just let you know that.
Yes.
So, I listened when I couldn't come to the video tapes, but it's really, really hard to hear. So I would like someone to explain, one time I was here and Adam, I believe you said that there was rent in this building. Can you explain that?
Yes.
And why there is rent?
Mhm.
Number two, I was thankful that there was a guy at the door, but what are we doing for, like, weapons checks? Cause we're here later than everybody else, so. And number three, is this program called O&M?
It's operation and maintenance. Usually you see the O, the and symbol, and
And
then M.
where can we get more information?
Right now, there really isn't a whole
We're
lot besides the
designing it.
state. So the state has minimum requirements. I don't know, I'm gonna pause. Well, I'm sorry, I'll let you keep going, then that way you don't take your time.
Okay, well, the rest is just having to do with that, like, when's the public gonna get more information? It's added to our taxes, is it gonna be January or July? And is there an average amount? And I'm sorry, there's no excuse for someone who moves here and doesn't know about septic systems, they should be fine. Sorry. So, that's all. So if you just wanna answer this for
Yeah.
me.
Thank you very much.
All right, so I'll just start with operation and maintenance first. So operation and maintenance are also called O, and they use the and sign and M.
Okay.
That's a state required and a state unfunded program. So in essence, you have to have local fees or some way of collecting revenue
So
to.
the state does not fund it,
Correct. So
just the county?
yes. So sometimes there might be a program where the state says we will give you $100,000, random $100,000 to operate this program. In this case, they don't. So this is a
But it's
program.
mandated by the state.
Correct. And there's a soft date that's supposed to be in place of like 2025. That's always the soft date we've heard. I don't think it's written in the code anywhere, but that's a soft date.
Okay.
What I like about O&M though is it's proactive. So as you're saying, like Berkshire Estates, they were required to go to sewers instead of being on septics because there's so many septics that failed in that area.
Right.
For sale of properties, what we have now, the only time you get tested on a for sale property is when your house transfers. So if you don't sell your house for 100 years, you don't get tested for 100 years. Just a random example. With O&M, there's gonna be a yearly component for that where you have a service contract that your septic is up and running, it's operating properly. And I'm paraphrasing all this because it would take forever to tell you everything.
So 1 year or like 2 years or 3 years? Because the septic people say you should pump every 2 years.
Right, well, pumping is different than the service. There's also service as well. So
Okay.
we are gonna work, the board will have to approve that. That comes down to them, what level they have. We're trying to make it as low cost as possible, because it's not, I don't wanna just tack on one more thing you have to pay. I mean, the reality is we get that all the time, right? As an
Right.
American citizen, there's 1,000 things you have to pay. The other thing is to make it as convenient as possible. So and I hate to say that, government employees, but keep government employees out of your property, out of your house. It is most of the time you're gonna deal with the private sector on, and then they will communicate with the public sector, being us, the results, and we'll have those filed. We're also working on an online program that there's a lot of communication that can be done online, and you probably have all seen it if you go like, even like Amazon's probably a good example. That little like messenger box in the bottom right where you click on it, you can talk to somebody. It'll have something like that built in as well, where you can talk. I think it's called Customer 365 or 360, like that, and you can talk to somebody, which is great because so septic as an example, we have a number of people that they don't. I mean, the one I'm trying to think of, I think back when Mr. Quaid was still here, didn't know they had a septic. And he goes, I'm doing this, I'm not getting any bills, it's great. And then he goes, we have a septic, so there are no bills until you gotta pump it.
Right.
And that's what it comes up with. I mean, the reality is, if you move from Geauga County or, somewhere else, let's say Franklin, you may have never had that, you may have never experienced it, you don't know. And you go, hey, this is great, I just don't have to pay a sewer bill.
It's gotta flush somewhere.
Right, it has to, correct. So There'll be some communication with that. We're also trying to work with Jerry Morgan, over the county commissioner's office, to educate people, because a lot of this comes down to education. If you don't know what you don't know. That's what sometimes just happens.
Right.
So how do we educate the population on that and why we do it, how it works, and those factors. The tax side of it, we don't know 100% yet. That was something that had been discussed with, during a previous administration. At the time we were told no, it was communicated back to the person at that time that the answer was no. Talking to him recently, that was not the case. And this is doable. It just can't be, that the auditor's office is not gonna do all the work for us, and that was kind of what was communicated, was there was just some back and forth in that. It'll reduce the cost though, which is the big thing I'm looking at, is reducing the cost. It should be quicker and faster and more agile that way as well. Because the auditor's office is an expert at doing those things. We don't have that, we don't bill that way normally. We just do, hey, you bring your check, get your permit, you're good. The weapons check, I'll reiterate usually what you say, so I'll make sure I answer your question. The weapons check, we don't control the building, so that is 100% the county. There is currently not a person at the front desk. That's actually our staff that we have stayed late. Because my bigger concern was, there's not a lot of signage in the building, and if you walk in, there's not a lot of signage. So if you walk in, you might not know, okay, health department, where am I going with the health department? So we have someone staying down there, and they'll be here. Someone will be here every night at every one of our meetings, every one of our meetings to check people in and check them out. My other thing is, I don't wanna leave this building with someone, let's say going to the restroom, we shut everything down, the alarm is on, and when they exit, the alarm goes off.
Okay.
So there's a double check on that as well.
Okay.
Did you have another, was there another?
Rent.
Rent, yes. We actually don't have a contract yet for rent. We had a number that was thrown out there, but we are not a county agency. So we are not.
So that's why?
Yes, we are not under the purview of the county commissioners. We are a legally separate entity.
But didn't they make you move here?
No, we could have went somewhere else.
You just had to get out of 470.
Correct. There's pros and cons to all of it. Had we gone somewhere else, I would feel bad for the guys doing more construction type work, where they're going, maybe, let's say we stayed in Chardon, random example. They go to Chardon, then they have to come up here to the building department to go back to us, maybe come back to here.
Yeah.
All the while they're losing hundreds of dollars an hour by just bouncing around trying to be, because we're just inefficient in essence. So we did do that. We would have a rent agreement once we have it that would be contingent on whatever that agreement says. And then we'll go from there. But we were initially told there would be rent. I just don't have a contract yet.
Okay, follow up on the O&M.
Yes.
So the O&M is just inspecting the system,
Correct.
not pumping, but inspecting.
Correct. You
Okay.
should still obviously get your septic pumped every 1 to 3 years
Right.
for the average person. I mean,
How
there are,
many,
you know,
depending on how many people are in the house.
there's the exception of, I usually hear like, it's just me and my wife and, it's, we have no kids, well, maybe every 5 years then, if you just, 2 people who have nobody else in the house.
Yeah.
I got 2
May I
kids, I
make
got
a
pump every 2 years.
suggestion?
Yes.
Because the septic people who are gonna come inspect our stuff are gonna charge us more if they have to send paperwork to you saying that everything's okay. Maybe there's a way that they can just hand us a piece of paper and we can upload it ourselves.
So that's what we're
Might
trying
save
to,
some-
we're trying to work with the service providers to make it as easy on them as possible, because one of the downsides is, to our understanding, we are responsible if the report does not get back to us.
Okay.
So if someone just doesn't do it, we're ultimately responsible.
Yeah, okay,
So there is some involvement with the health department. It should be minimal at best though.
okay.
The other reality is, I don't wanna see what happened with FSOP happen to O&M. We can't get behind on
Oh,
this.
yeah.
There will be some behind in terms of, maybe we expect to get 5,000 systems on a year, we can only do 3,000. That might happen, and we have to push back certain dates. We also have either the most septics in a single county in Ohio or the second most. We were talking to ODH one day, and they said you either have the most or the second most. For some counties, O&M might be like, yeah, we've gotta take 4, 5, 6,000 septics, no big deal. Here, I believe last we looked, when Mr. Sage was still here, we had 30,000 we figured were on record, give or take, and we had probably 10,000 that were not on the record. Maybe old systems, put in without the permits. There's 30 to 40,000 is our best number. 25 is I think the lowest we thought we'd have in general, but I think at that time we figured it was 30 to 40,000 is the reality.
Right.
That's a lot.
That is
And it's a monumental program. It's huge to have that many staff, that many clerical, reviewing reports. It's monumental, and it's not. I mean, I would say for sale of property, which is our biggest thing, it's going to dwarf that. I mean, it'll dwarf it within a couple of years by huge majority.
How do we expect to keep up with it then?
So obviously the fees will be generated. Hopefully FSOP wanes down as O&M picks up. That's why we ended FSOP when we did. Is because I can't do both. I don't have the staff, I don't have the money.
Oh, yeah.
And what I'd have to do is you'd have to jack the fees up to account for the difference. And that's not fair to the public either to just jack up fees because we have no other way to fund it. But the goal will be is one wanes down and one picks up, and theoretically it evens out. For me though, as I told everybody, O&M is proactive. So it's keeping everyone accountable on the same page, and it keeps the community where the community wants to be. FSOP, like Berkshire Estates, if you just don't take care of your septic and it adds up to enough where the EPA steps in, which they did, that just, we can't overrule the EPA. That's not something we can do. And the county commissioners have been having, it was every meeting probably for 3 months, 4 months, which is Berkshire Estates almost the entire meeting. It was a huge discussion point. So we're doing the best we can to help with that and make it as simple and efficient as possible, with as minimally invasive as possible. But still, we have to protect the environment. I mean, that still is the number one thing. I mean, it's protecting the people, but we all love the community. We love having our trails, we love having our parks, we love having the waterways. That comes with responsibility. And so that's where that responsibility comes in. And that's why, you know, we have Mr. Lark, we have our EH team. A lot of that is on them. It's on Alta and her team to make sure they keep up with their side and protect the environment. Because you see what happens in other communities when things get polluted, when, you know, I mean, what Lake Erie caught fire, I mean, how, you know, years ago. But that's what happens when it goes unchecked, because people will take shortcuts. And that our goal is to, you know, we're that barrier between those shortcuts and what should be done.
So you're thinking it's like a minimal fee, like less than $50 or something?
Yeah, we're trying to, so one thing I always do, or I ask to always do, is that if we're gonna have a fee for anything, and it's something we've done in Lake County as an example, I pull from that because I've had more time being in this position in Lake County than here, is that what are the surrounding communities charging? So if the surrounding counties are $20 and we're 50, why are we 50? If they're 25 and we're 10, why are we 10? Are we missing something? We're not doing something? Are we negligent on it? But if the rest of the counties are $25 and all things are equal, we shouldn't be 50 to 100 to 200 to 250 to 300.
So it's not going to be a Bruce Springsteen concert?
No. I sure hope not. I think we're, with working with Mr. Walder and his team and some of the advancements they've made with us, it's, and the county commissioners, I mean, I go to all their meetings, not because I enjoy listening to the county commissioners for 2 hours, but it keeps us all accountable, I think, when we all communicate with each other. It's a lot easier to say, oh yeah, I heard Adam talk about that, here's what it looks like. And that communication keeps flowing out and out and out, versus these silos. And I continue to hear, especially here in Geauga, there's these silos everywhere. You know, so-and-so doesn't want to talk to so-and-so, doesn't talk to so-and-so, doesn't go over here.
Right.
We gotta come together a little more, which is why we're partnering with, you know, Board of Mental Health, looking at helping with Judge Patchkey. We do everything we can to bring everyone to the table.
Okay.
So that's why the long-winded
I have a question to that point you were making with like keeping fees on the same page as surrounding areas. How do you do that when you're passing off the inspection to private companies? How do you keep everybody on the same page and there's not
yeah, so
80 contractors charging $850 for an inspection?
Yeah, so that would be on the contractor side for the service provider. That we don't have any control over. We have our set fee that the health department's all charged that have O&Ms. That fee is what I'm looking at, while still building that program the best that we can. There's a lot of things there's some stuff we can do and there's some stuff we just don't have control over.
You know, I think is, the misconception is for the operation and maintenance program, when they say they're studying the fees, there's not going to be just one price for Vicky's house or my house or her house. It's going to depend on what kind of septic system you have, because if you have a certain kind of system, your fee from this department may only be, I don't know, say $20. But if you have a different maintenance, different septic system, it could be $200. So that's why it's so you know, they just can't go and come up with a number. It's not just one number. It's it's gonna be a array of numbers, I don't know what, 10 or 15, I think
That's
other
to be
counties have.
determined.
Yeah,
Right.
the board has to approve it, I can't, I
But,
don't do that.
you know, so it's gonna be
There's gonna
different.
be your fee and then their fee to come out and do.
The service provider,
inspection.
yes.
Okay.
Yeah.
And what the service provider charges is, we can't control that. Now, if you're asking about like if a private installer wants to do a septic inspection, is that what you're asking or no?
Yeah, I mean, it's not that they want to, it's part of the program, they would have to.
Right, but true, I mean, I've been around for quite a while in this county, and I mean, I can tell you before the point of sale inspection, we did, as a realtor, we always recommended the buyer to have an inspection. And most of all, the installers, they charged a fraction of, they didn't charge $480, they charged like $200 or something, you know, and basically, in most cases, they did probably just as good or, you know, a better inspection than the county.
I can't say from experience with these programs, our fee would always be higher. It would 100% be higher. I should say 100%. More than likely, it would be higher. We've done the review of how to do it, and we'd be higher, just because what we pay.
Than a private.
Than a private, yes.
I think what might be confusing here is there is the permit fee, and then there's the inspection fee.
Yep.
Okay, that inspection can be done, if it were done by us, as Adam said, it would be more expensive. If you go to a private person, chances are it'll be less.
And we'd have to
Okay,
hire.
it's a company.
We'd have to hire a ton of people.
He's saying what keeps these private sector people from charging like all
Nothing.
different kinds of prices.
Nothing, you shop, and
Yeah.
what we know is that in this county, many people never ever have their systems pumped or inspected. And this is
And
what's
those
new.
people should be fined.
But many people, as Adam said earlier, they move here and they have no clue what they
Well,
have to do.
Yes, but they move here and it's on them to figure it out, and that's why they should be fined. You just don't,
Well,
I mean,
I
I
think-
don't
no.
move to the city and
I-
figure out the crime rate once I get there.
Hopefully
I think
O&M
real
will
estate,
fix
I
it.
think real estate people, when they sell the house, okay,
Correct.
should be communicating that,
Mhm.
especially if you're coming from a county that has no septic, okay? But there are people that, I can tell you, I have neighbors, and I am sure they have never done anything.
Vicky, I think one thing that's really important is, I think you're absolutely right, but the problem is we can't fix, people don't know what they don't know, so the best thing we can do is serve as another avenue to help advocate for homeowners and to provide an additional channel for education and at least kind of set the stage to say, how many venues can we have for education for this while we're developing it?
Yeah,
And I agree, but you know, I mean, the saying that the realtors should be telling people is like,
Yeah, it's not any
that's
one
not their
person's responsibility, I think it's a lot of
responsibility of the
people.
homeowner.
Yeah, I think it's a lot of people's responsibilities to help the homeowner, but ultimately I agree with you, it is their home. I mean, it's my home at the end of the day, I'm the one who's affected if my system is
And it's
not
called
pumped.
responsibility.
Yeah, and I
Right,
think that we can
but-
support people in ultimately having that accountability, though I think we do.
And I
have
agree,
to
I
do our
think
due
there should,
diligence.
hey, when you're teaching young children to behave in a certain way, you give them a certain period of time, and then after that, there are consequences for bad behavior. So let's do that with the
There's-
general public,
there's a-
educate them, give them a
there's a lot
certain
of
period of time
education
and
that's
slam
needed.
that hammer down.
there's
Well,
a lot
that's-
of
And
education needed.
hopefully the O&M program will help with that. But you know what, I apologize, Mary, I think it's your
Yeah,
turn.
and-
sorry.
And one last
As
question.
township trustee, when people would move into Clarendon, which you are currently in,
Mhm.
I would get a call. I haven't gotten a sewer bill. When's my
Yeah.
when's my garbage gonna
Yeah.
be picked up? They don't know. Years ago, 79,
Right.
welcome wagons would come and give you a little package of information. There's no more welcome.
I never got my fruit basket from you, just saying.
Well, I'm not a trustee, but I would
Where's
have
Tiber
been bringing
at?
in all the
Yeah.
baskets.
Yeah.
And Zach, real quick, just to circle back 1 second, because I'm probably out of my depth a little bit here in terms of Mr. Lark knows more of that stuff. I don't think, to my knowledge, we've seen other communities, other counties, see someone spike up just because of the O&M program. To my knowledge, we haven't seen like a giant spike in that. So I'm not saying it couldn't happen, but given that there's you can go to multiple different persons
You
for
got
that service.
That's competition.
More than likely that competition doesn't allow that price just to skyrocket. if it did for some reason, I mean, I'm sure we'd hear about it from the community, we'd have to have that discussion as to what does that mean? Are we all of a sudden lower? And then do we do that? But it would mean hiring an incredible number of staff. I mean, I couldn't even imagine, I don't know how many we have to hire. Given 40,000 systems, 30 to 40,000 systems, if we did those inspections, even 2,000, 3,000 a year, I couldn't imagine how many staff we have to hire. It'd be a lot.
I will say one concern I have with O&M is it creates more demand for inspections, right? And so do we have the supply of inspectors to handle that demand? And if we
Yeah.
don't, what happens is Zach's right, the price goes up,
There's
right?
supposed to be 2 service providers for each type of system, if I remember correctly. Now, some systems, one specific one, we have like almost no service, and Dan Lark has reached out to ODH, and what do you do if you don't have to? We haven't seen other counties though, to my knowledge. I mean, from what I've been versed on O&M, we've not seen them spike in those other counties. They've been consistent. Because a lot of people, like I know I do, I already had a service contract. I already have one. I want it pumped mine was every 2 years. I want them to come out every 2 years. They check it, they make sure it's good. And 7 months ago they came out and said, hey, it's failing. So we put a new septic system in. And now I have a new service contract with the new guys who run that system. And they come out and they inspect it. And the price hasn't, I have not experienced a giant price increase.
I'm just saying though, if you have all these people, like you're saying, that had a system for 20 years and haven't inspected it or pumped it, and now you're saying they have to have an inspection, you have more, your
Right.
demand for inspections is increasing, and is there the capacity to handle that demand?
And I guess that would be, the question come down to those service providers. Now in Lake County, to my knowledge, we didn't see that. So even though all of a sudden now you had to do it, we didn't see this like giant spike in anything to that nature, to my knowledge. I don't think we see anything here because I think someone would say, hey, I can make money doing this.
Yeah, I'm
Why
not
not
saying
do
it's
it?
necessarily gonna happen, but I do think it is a real concern.
Yeah.
You're
and-
talking about you would have to increase staff and you would have to have more money to take care of all these inspections. It's just these little private companies doing it. They're gonna have to do the exact same thing. So where does that leave the bill? Up, just like it would with your department.
Well, and that's where I guess that's where we'll have to, I hate to say time will tell, but we'll have to look more into it and see what that would look like. Knowing what our hourly rates are for people, we will always be more expensive. I could not imagine time would be less expensive.
He's not saying that they would raise the cost because they have to, but because they could.
No, I'm going either way. Could or have to. I'm going on either one of those.
Is there gonna be a criteria for the inspectors? Or can I hey, I'm gonna go out and,
Yeah, Mr. Lark, I do that to him, but as far as I recall, they have to be certified on that system, whatever the system is.
all right.
Which there's multiple different kinds.
Manufacturers have to certify.
Yeah, and there's more than
Service
one.
providers.
The installers and the service providers.
Yeah.
Well, you've got the drip, you've got the aeration, you've got the leach field.
Right.
Yeah.
I mean,
There's multiple different
you guys
kinds.
Be more active with your board here.
Yeah, when Mr. Lark's back next month, we can go over a lot of that. Right now, we're just trying to get the program up and running so we can start. Mostly it's the NPDS that'll probably be first. There's a lower number of those in the county, so it's an easier one to take a bite out of to start with.
The what?
NPDS, it's a
Off-class history.
yeah.
National.
It's a specific kind of system.
It's an Ohio permit.
And there's not a ton of them in the county. I mean, there's a lot, but there's not a ton. There's less than other things. So it's one we can take a bite out of. And if we learn a lesson, we can adjust the lesson before it impacts 1,000 people or 2,000 people or 3,000. So, yeah, we're still in the infancy. Like I said, I'm not being vague on purpose. I am being vague on purpose because the board has to approve it. I mean, I can tell you what my ideal is or goal, but if they say no, I want to do something else, that's just where it goes. And we've been trying to.
You said Lake County is already using this?
Which we're modeling it kind of after that one.
So
for
is
the
there
most part.
information on Lake County's?
Yeah, I was actually gonna mention, I don't wanna reconnect my internet because it'll just
No,
flood
that's fine.
emails will come through, but if you go to Lake County's website, it's like it's lcghd.org, it's Lake County General, it's just initials.org. We have entire pages dedicated to all of that. We're modeling it after that because it's relatively low cost and the program generally works.
Seems to be working.
Yeah. So I don't wanna recreate the wheel and cost of,
Right.
just incur tons of costs when the program already works in other counties. And it's not like Lake County created that wheel and said, oh my gosh, we solved, world hunger here. we took it from somebody else. And it just kinda, you just figure out what works and what doesn't work for your community. And there's stuff that might not work here that works there, and we'll adjust it based on that. But it is a requirement via the state. It's not like, to Zach's comment, I would love to say, hey, we don't have to do this, that, and the other. There are requirements we have to meet, and that's one of them. So it has to, at some point, certain things have to get done. If we don't, the state has multiple options, one of which would be they sub out the entire environmental health program to a different county. And that would just be given to somebody. I don't say given, but it would go out to someone else.
Let's move on to.
I think
Yeah,
this
sorry.
needs to go to public
I beat the
education
dead
session
horse
in the future.
with a bat.
Okay, so, Ms. Briggs.
When you're ready, Mary.
Well, there's a couple things I wanted to say about things that happened earlier in the meeting, but I'm here for something other than that. But I'll say it, okay, quickly. Monkeypox. Worldwide, 19,188 confirmed cases as of yesterday, 3591 in the US. Dr. Fauci, and the predominant men-to-men transmission is in New York City, and Dr. Fauci is talking about not bringing it up because of the alienation of gay men. So, and that aside, on the 8th of July, I made a public records request of the health department. It was given to Alta.
Sorry, you're giving them to sanitary, not all.
My job. Oh, yeah. Adam was kind enough to call me on Saturday. What a public servant. The following day on the 9th. I have not received one piece of information yet, but part of it was posting of the minutes. There's some more important things, okay, that were then following Tuesday, March, April, and May were posted that hadn't been previous. Okay. I have no personal animosity towards any board member or any staff. You didn't
Mary,
wanna give me.
one second, actually I'm gonna ask, because Rich actually made a comment when you were talking, you're okay with her?
Yes,
Okay,
we let.
so I did give the public records request to the board, but Rich said given that there's a limited number of people here, he's willing to let you talk beyond the 2 minutes. So I don't want you to feel you have to rush to beat that clock if he's gonna allow you to go beyond that. It's not fair to you.
Vicky talked longer than 2 minutes.
So, go ahead.
I have no personal animosity towards any board member or staff member of the Geauga County Health District. The people that I've known Alta for decades. Am I pronouncing it right? Yeah, good. Dr. Pat, who's leaving, is my personal physician. And the three people I have issue with are people that have been kind to me. So it's not personal. The three on the, now see, three on the left. Adam, I get along well with. I'll go with the easy one first. He's employed by Lake County and Geauga County. He's part-time. I think that possibly a time study, I don't know how his salary is. I have a full life, but here I am because of my concern for my county. Surviving and a full plate of responsibilities. Also, with the interim director, I think there should be a time study when he's able to be here. Maybe what he does when he's here. With Adam, I don't know. I was talking to someone. With Lake County and Geauga, who's the wife and who's the mistress? There used to be a saying, don't Cuyahoga Geauga. I don't want to Lake Geauga either. I don't know how many programs are being farmed out to Lake County. I know there's a problem with everyone with employees. but we are not a cookie cutter state. And Lake County has different demographics and sewers everywhere, and it's different public health than septics and groundwater and well water. There's just something that doesn't, I'm concerned. I don't have any animosity, but there's certain things that aren't passing the smell test with me. We have a president who's been kind to me, who's a realtor. Now, if he sold realty exclusively in Lake County or Geauga County, I wouldn't have a concern. But I do, because I believe he sells houses in Geauga and makes recommendations on public health and voted on point of sale. We have another person on the board who was absolutely lovely to me in the emergency room. And I don't know their motivations. I'm not saying that there's anything wrong, but it just sort of feels not right. And your father is an installer, and I think her spouse is involved in the industry also. I just have a gut feeling of conflict of interest. I have no proof, and I do love my county, and it's not personal, and I hope you guys continue to be nice and talk to me again. But with that, I'm going to present a preservation letter. She'll know what it is. She's an attorney. I didn't have access to a computer. In advance of possible litigation, I am presenting a preservation letter to the Geauga County Health Department Board President, Richard, how do you pronounce your last name? Perino. To not delete any information from the following. 1, home and work computers, email communications, or other forms of correspondence, Geauga County real estate transactions currently within those devices, or any organization that he belongs to and has access to those devices. Any social media posts that Mr. Perino has or uses, to include Twitter, Facebook, but not limited to. Any cell phone devices within his control for text messages or other forms of communication, and also photographs currently on these devices. I don't care about photographs. This is a legal request that runs for 365 days from today. That's what I read about preservation letters. I've seen your Facebook, and I don't want anything deleted, for sure. And if it goes, because it's all about real estate, and which is his business, but he's also voting on things that impact people and point of sale. And I took a picture of it. It's handwritten. It's not fancy. You get the idea. It's not to be offensive. I have nothing against you, but it just doesn't seem copacetic. How many NPDSs do we have? Do you know?
I wanted to actually say the number, and I can't remember. Do you remember the number off the?
I don't remember.
Dan and I just talked about. I just can't remember the number that was specific to NPDS.
So, I mean, I speak from my heart. I really do. I still offer to be as helpful as possible to this health department if they ever want to get a mass gas spectrometer to raise some money. Also, you should contact, maybe NOACA might have funding. There's supposed to be funding for some pollution aspects that your department might be able to utilize. Robert's Rules of Order Conference. Find one in either Hawaii or Myrtle Beach and go on a field trip. Anyway, I'm just kidding. I await public records requests, and I will have more. Thank you for your time.
Thank you. Okay, so, do you have any comments, or should we go to the next person?
I mean, I think, the only thing to hit on is, so Dr. Cameron is not interim, he is the, medical director and the health commissioner. His contract is give or take 2 hours a week,
Okay.
which is even high for some medical directors at times. He's also health commissioner, and he comes in and does talk with all of us and make sure everything, you know, he helps wherever he can. With my time, my contract with Geauga is specifically for 32 hours a week. I do more than that, but, because I attend the weekends, you know, if somebody calls, call them back.
Okay.
But specifically, that's, the contract is 32 hours a week,
Okay.
so.
So that answers that.
Yeah, so those are just set via contract, so it's simple that way. Because,
And you're permanent.
yeah, and because how the world works now, where you can do everything electronically, I am here a lot, because I can do things electronically back and forth.
I mean, it's just, I'm not coming on like bulldog. It just feels funny. So because of the Facebook, I've asked you to mostly do that. I'm not saying there will be any litigation. I don't want any litigation, but I'd like you to preserve that, sir, for just in case.
And we actually used to have, I don't know if you know this, it was actually a neat historical fact. We actually used to share a health commissioner back in 1925, Lake and Geauga. It was a health commissioner shared amongst the two. So it was just an interesting fact.
I don't want a joint district, and I remember with the fair coming up, we had a health commissioner, Dr. Frederick. Anybody know about him? You probably do.
Who was it?
Frederick.
That was before my time.
Oh, so he was the health commissioner, and during the Geauga County Fair, he was a veterinarian. He had health department employees help him move his house, and he wasn't health commissioner for very long after that. What was that? It was in the early 90s. Yeah. Red-handed.
Yeah, and
Ethics stuff.
yeah, we try to avoid that.
But that's just history.
Yeah,
I mean,
At a church meeting.
yeah, and we, the board is the catch-all, should there be any, I'll use your original Lake County of Geauga, that's what the board steps in. Because that would be, if for some reason, which it doesn't, we really haven't changed any programs except for O&M, which is a requirement. And we can't really run FSOP and O&M simultaneously, not to mention it's the same program, it's just a different spin on it.
but homeowners can require during the contract, not the homeowners, but the purchaser, that it be inspected or money be put into escrow. If they're aware that they could be socked with,
And we still do that as a voluntary thing. What we tend to see though, like, I'm not sure if you were at the one meeting, we had a lady come in, Alistock, Joyce, thank you. She got her letter 3 years after selling her house. Escrow was already gone, nothing's there, had no idea. And that is a consistent story we hear a lot, that 3 and 5 years later, people are just hearing about it.
I know an Amish couple. They bought a house, it was never inspected, the people sold it to them, and they got socked when they sold it.
So O&M should theoretically account for that though. So you have a consistent, reliable inspection that nobody reports on.
Or they go to the bleach fields eventually. I mean, because really that's the majority.
Yeah, it would depend on how the program is set up, what the service provider requires or the manufacturer requires. That would be based all on those things. And there's a lot that goes into that. But it's supposed to be much more proactive, so you don't have that where someone comes in, buys a house, 3 years later they find out, oh, it says it's FSOP, I go do it and I fail.
So I don't wanna come across as an adversary because I'm really not. Thank you for your kindnesses to me in the past, and I appreciate your time tonight.
No problem. Okay, and obviously you don't know me too much, but I never delete. My emails probably have 80-some thousand or something in them, so I do tend to keep them. But anyway, with that being said, any other comments from the audience? Okay, so Do we wanna, move to adjourn to executive session to discuss pending litigation with counsel, with counsel?
No, he's not gonna be here, it's just gonna be over the item that came up.
To discuss pending litigation, do we have a motion?
So moved.
Do we have a second?
Second.
Roll call vote, Ms. Breaky.
Yes.
Ms. Roman.
Yes.
Dr. Jones.
Yes.
And Mr. Moreno, yes. So we are in executive session as of 7:06.
And Mary, I sent that digitally to Rich, your letter, I sent it digitally to him, so he has a copy.
Thank you.
Yep, thank you.
Okay, good.
They're probably just going to my office. He's gonna be in here, 'cause much to his chagrin, but there's really nothing in here that can go anywhere. There should not be, no. I'm not aware of anything that needs to be action over. No, they tabled it now. We'll have to get a copy and give it to them.
Could I
They
see the
could vote on
sign
it
sheet?
afterwards.
We probably
I just
will
wanna see
after
who's
they
here.
probably will. If you want it right away.
I may need to.
How do you like the new building?
Yes, so we probably
It's
will.
okay.
I can't pay any bill for anybody without that.
After we come out.
that was the only
Yeah,
difference.
'cause I hear-
This
oh,
was
sorry,
agreed by
is there-
legal.
But I didn't know which one it was.
I told you.
Do we
Yeah, I
have
would
it?
have to look.
Cough it
Cause
up?
I don't know which, I'd have to look and see which one. Oh, sorry, it goes with, it goes
Oh.
with this one, cause that's the H, that one's mine. It wouldn't go with that one, it would go with H's.
Do you want me to go, I can run
Can you-
copies of these
yeah.
real quick?
Oh.
Yeah. Alta has the addendum, so she'll bring that, she made a copy for everybody so you can see it.
Okay.
It's $55 an hour flat rate.
Okay.
Are you coming back in, or should I go make these copies?
If you wanna make the copy, we'll hold off a second,
Okay.
just so they can see it.
Man, am I cold in here.
I know, I finally got comfortable in this.
I don't know. Oh, it's definitely cold in here. I'll go up a little bit.
Here, this is you, Carolyn already has one. of
Yeah,
these, so
yeah, I think that was mine left for you. I'll take that.
Yeah, 'cause I already got mine, right?
Yes, I gave you, yeah, when I saw you that one night.
There's a bunch of turkeys in the field and across the way. You saw a coyote too?
I'm not surviving.
I know, I'm thinking about those
He was
cookies
watching
too.
the turkey.
Poor Lee.
I told you.
I always tell them, you're not gonna be hungry the first cruise you're on the route, so I'll bring food.
One of my post-board meeting meals.
YouTube, what site?
Just search ADP Geauga on YouTube.
You guys wanna come out of executive session, or you wanna wait for Alton to come back? We can come out.
Let's wait for-
fast,
let's
right?
wait.
Tomorrow.
So, do we have a motion to come out of executive session?
So moved.
Okay, we have a motion, do we have a second?
Second.
Okay, Ms. Brackey,
Yes.
Mrs. Roman,
Yes.
Dr. Jones.
Yes.
And Moreno, yes. We are out of executive session, whatever time it is.
Do we need all to take minutes though?
2041. Yeah, we're waiting for her to come back.
So
Okay.
we'll have to wait, thank you for that.
2041 is what it was.
Yeah, she had her phone running, I think, so.
Okay.
If not, we'll go to the second again. Alright, when she comes back, we'll have to tell her who's seconded, or first and seconded.
You want me to bring in a flag next time? or-
Those speakers.
I'm actually probably just gonna get one. I don't know if they're gonna put one in here, I don't know.
They're hooked up.
Yeah, they'd probably kill us if they mounted it on the wall.
Oh, yeah. I've already told the staff, there's no mounting anything to a wall permanently.
Thank you, Alton.
Thank you. So the last page is the part that
Is it added?
is the addendum.
Okay.
The cough is longer than COVID.
Did you say it's,
I've had it longer than COVID.
okay, I thought you said that.
You cough? Well,
Sounds like someone with
Why
COVID would
wouldn't I?
say. That's what it sounds like someone with COVID would say that. Yeah, the rest of the contract's still the original
I
contract.
see.
Yeah, that,
Okay.
we just did the addendum for the amendment, or sorry, when Rich spoke with Ron, that was the addendum or amendment, whatever.
So we are extending this for a 1-year period. Did I read that right?
Well, the date is back to January 1, 22 to December 31, 22. So
Okay.
Right, so
Yeah,
1
right,
year,
okay.
and
1
then
year.
you, with 30 days notice, we can change it.
Yes. Okay.
Okay, so
Are you-
who's contractor in this? Is it defined somewhere that I'm missing?
It's just, it's the Lake County Health Department would be the person supplying the person, and
Yeah, but-
Geauga would be taking the people.
So they use the term
Yeah.
capitalized contractor, but it's not defined term. And it's not, so we don't know what that means. So that is Lake County General Health?
That's the one this is the one that already went to legal.
Truthfully, we already got that one approved, we're just
Yeah.
trying
Well, I
to-
didn't approve it, I don't think this was
No.
prior to
No, that was
me.
prior to, yes.
But truthfully, I had,
we
We
that
had
it's
other
kind of
things.
inferred that
Okay.
the contractor is
Well,
Lake
this,
County
so
based on
this
that
should say
paragraph.
Lake County
Yeah, I
Health
think the
here.
first paragraph is what says it.
Yeah.
That shouldn't
Why
say
don't you,
contractor.
Let me
No,
know if
con-
this is okay, and then whenever we
Okay,
can change,
okay.
and then I'll make.
All right, I'll just look at the
we'll
addendum,
change.
that's fine.
And Carolyn, just to clarify, I stay out of this, so I'd like to say more knowledgeable in this, I stay out of it just so there's not a conflict.
Yeah,
In the first sentence, could you simply define the agreement is between Geauga Public Health and the contractor, Lake County General Health District, and refer to
well,
them
you
as the
could say,
contractor?
so how you would do
later?
this is you would say in parentheses, after Lake County General Health District, you could say or, and then the contractor.
And then just refer to it
But,
throughout.
but how I would do it, cause I don't think they say contractor otherwise, so what happened is somebody did a copy paste job here, they had a form contract, and they copied and pasted it, and then they forgot to control F this one. It's a contract, so this should say Lake County General Health
That's not
District
us.
instead of contractor, I think.
If you guys wanna do something as amended on that, you
They'll
can.
be afterwards,
The-
another time.
Well, I mean, they could do it now, it would just have to, I mean, that wasn't the original intent, but it could be done.
Okay.
The last page was the only,
The thing we need to approve tonight.
The
Yes.
hourly rate.
Hourly
Yeah.
rate
if everyone's in
extension
agreement, that's
from
Yeah.
30
First
to
three have already been approved by the prosecutor's office and the board. The fourth page is the one that is just gonna be an addendum to the
So what is,
original.
PRN workforce?
I'm sorry, I didn't hear you, Carolyn.
What's
PRN.
PRN?
Pro rata, like, as
Just
needed.
As needed.
Okay.
yeah, it was just the employees needed, because at least, if I had to guess, given that I have a contract similar to this that we use with some of those schools, it's so that there's not like an inception, it's gonna be like 40 hours a week.
I gotcha.
If you only need 20, you only pay for 20.
Yeah, you need 10, you need 10, you don't need any, you don't need any.
And so far, those needs are generally derived from vital stats, if they need training, we're doing that, or it's from environmental health, if they need something based on that.
So whose paper is this on? Is this our paper or is this Lake County's?
This is your guys's, well, it's Geauga's, I don't wanna say Lake County, but it's Geauga's, cause Geauga's letterhead.
Wow.
You know, that's approved by your legal, it's part of your contract.
Yeah, because they're using abbreviations that, I mean, there's drafting issues with this. I mean, I don't know if you guys care about that or not, but this is not,
if
so they
you-
use these abbreviations that aren't defined here, and then they say like parties, lowercase, it should be uppercase parties.
Who typed this addendum?
So why don't you, okay, if you wanna, let's make the changes to get the addendum approved tonight, and then you can, let's review the whole contract, and if we wanna make the changes as a board, we can, but we've already, I mean, my signature's already on the three, the first.
Yeah, I mean,
So
as long
any
as we don't think it's
change-
gonna like, I'm just looking at, I just wish I had this, ahead of time, cause
No, I know.
I'm just afraid that I'm missing other issues, like I'm just quickly seeing like contracting issues
Okay.
by examining it. Like this is 30 days. It's fine.
It's these two things. This is when it
Yeah.
started.
I got 15 minutes before.
So this, but this is already,
Yeah.
Pat, so we just didn't have a contract in place?
What we did is we had, isn't the initial 90 days
For the H director,
For interim?
for any of this, the interim work? Wasn't it like 90 or 120 days?
actually, you have that September contract, oh, that's mine, never mind, that's the other contract.
No, I took it back.
This was the initial contract, it was a year,
From the start.
Yeah.
sorry, 9 months.
Yeah.
Now,
It's
everything's working fine.
to the 10th of this year.
Well, okay, so technically, we did not bring in additional staff.
I just wish,
When did we bring,
I wanna see like what the scope of the original contract.
In here it says Dan Larks was.
no, I'm looking at this. When did we bring in staff from? 3 months ago? 2
I'm
months
like, it
ago?
wasn't as early as.
No, it
Do
wasn't
we have to go by
January.
January to December?
I think we had three.
So, this is, shall not be effective earlier than January.
It says it goes into effect April 1st.
I don't get it.
We didn't use them.
Yeah.
They have to
That's
bill,
25.
they have to bill actual hours.
Why are we making it, so that we're
That's
actually
what we were
making this
discussing.
less? Yeah, we're making this addendum makes the contract less.
Sorry? You okay?
Am I wrong?
The addendum is supposed to be for the additional hourly employees, not
Oh.
Yeah.
for him.
Okay, that's, I
So
guess.
that's
where
why
I'm
this is
confused.
an addendum to an employment contract,
Shall
but it
serve as a
doesn't.
staffing service. See, that's what I was trying to figure out, is what this staffing service,
She was definitely.
by providing long-term,
Yeah.
so just anybody.
So, cause you wouldn't pay the environmental health director rate for a clerk. Because obviously, it's more or less a clerk who's helping the other people train.
So-
Okay.
I guess my only concern
Yeah.
is if we have, the way this is written, if you have like a high school employee doing work for us, I mean, I assume that's not gonna happen, but you'd be paying them $55 an hour, correct?
Yes, right now, because you guys have to say yes to things. So right now, it's a deputy registrar and a registrar
Yeah.
and a sanitarian.
I think what I'd like to see, so workforce professionals and frontline staffing, that's kind of open-ended of what we're approving here for $55 an hour. Am I wrong?
You could list positions. I think the reason that if I had to make a guess, because I wasn't involved in this, if I had to make a guess when I list positions, could it hamstring only those positions?
And then we have to then.
In case we needed somebody else, like a sanitarian or
So,
whatever.
Mark,
Yeah.
Yeah.
I think the rate is what it is because of their.
They're like clerks?
For, yeah.
You just did that, right?
Yeah, but how it's written is you would have just like a janitor,
$55
an hour, paying $55 an hour.
Some of them are like private schools.
But, so would we approve that first? It doesn't seem like that.
I mean, if you wanted to, you could put those titles, you could put the titles of the person in there. You could say sanitarian, deputy registrar, that's up to you guys.
Would that
I mean,
delay
to
the
make sure that
contracting
you
of
try to get Social
future
Security.
Oh, yeah,
contracted
yeah,
employee
because you
that
wouldn't
we
be,
have
you
to
wouldn't be
amend
able
it
to,
as,
yeah.
so, but I deleted it.
Well, it says professionals and frontline.
But she's saying, who defines frontline staff? Is it a
Okay.
janitor, is it
Yeah,
a?
yeah.
Right,
Oh.
because of the rate.
Yeah.
I mean, I just go to you guys and tell you who's
Just
gonna be
a
here,
top
just so you know, but, I mean, Carolyn, shoot me if I wanna be, if someone was nefarious, then yes, that technically.
And the time, the reason we're signing this right now is we're up against the time crunch?
Disability.
Cause this sat a little too long with legal, and then when I got back to her, we were using the people because.
Okay, and so legal someplace saw this,
Yes, it goes to legal,
okay,
They okayed it.
yeah.
okay, so if in fact we approve it tonight and then we decide we're gonna do a cleanup job after the fact,
Yes. It's only, and this is only in effect, actually, the main contract's only in effect until something 2023,
right,
April 1st of 2023.
Well,
It was
and this
a 1 year.
addendum would go to the end of
It was like a 1 year
Mhm.
contract.
But this is.
You would
Yeah,
have to,
the-
yeah,
the-
because the life
the
of the
addendum was
contract
only
is
till
longer
then.
than the addendum, so how does that?
So I'm
So this
trying
would
to
just
get them
expire
to vote
prior
on
to
just the addendum,
Okay.
go back.
Because everything else has been approved, you're just doing the addendum.
Correct.
So
And they can
pretty
come
much
and go
in
back and
December,
clean
we're gonna
this
have
up.
to
But
revisit
if
this
Carol
regardless.
wants to
Yeah.
make
Maybe
changes
get
on this.
Well, they're
we'll
just gonna
go
copy
through it
paste
tonight,
Right,
then
to extend it.
If she modifies it tonight, yes, I mean, I wouldn't say approve it without the whole board
Well,
seeing
I don't know why it would
modifications.
have taken them so long if it looks like this,
Okay.
but.
But if the rest of the board is in agreement, then we're
As
good.
is, and then make the amendments and then approve the amendments to this addendum.
So my thought is, I'm being careful because it's a contract with Lake.
Yeah.
My thought is if Carolyn wanted to say what the wording should be, that's what we could change it to before entering into agreement.
Before voting on
You
it.
just wanna do it
Yeah.
now because the whole board doesn't know what they don't agree
So
with
if she
Carolyn.
reads it with those amendments
Changes.
out loud,
I would think so.
can we vote based on what she reads as long as it's recorded as such?
Are you
You
okay
need
with
to
what you
move-
did, Carolyn, or
You
not
need to
yet?
move and second it, you need to discuss it,
Mhm.
and
Are
then
you okay with that?
when
No, I mean, I'm gonna vote no, so.
Carolyn
But
makes
if
her
you guys have
changes,
three votes, so you can still,
Then you
We'll
would
let them see
remove
it,
and
and if you
re-second
guys
with
want-
the changes, and then vote on it.
I mean, the other reality is if you guys wanted to look at this more, we could just have a special meeting at some other time.
Yeah, do it another time.
I mean, it is
Because
late,
it is 9
it's not
o'clock.
gonna, it's not gonna matter if it's today or tomorrow at this point, it's been sat on for a while.
So what does the rest of us wanna do? Do you guys wanna postpone this then, or what?
And my interest is protecting you guys in this case,
Mm-hmm.
given that, like Carolyn has stuff she wants to do, I would say wait on it. I wouldn't say sign it.
Lynn?
Make sure it's right before we do something that's not right.
I guess I would, since we have a
Professional here?
professional lawyer person here who
Yeah.
believes this is not correct, in spite of the fact other lawyers have looked at it, I would say let's make modifications, and then let's send up the chain we need to, and then bring it back to this group for a vote.
In the special meeting.
That's, I think it's the safer, I think it's the safer option. That way you guys are protected.
Do we still have to vote on it then?
You have to vote to table it, I
We're
would think,
gonna
it's an
table
active,
it.
Yeah.
it's an active.
So I vote to table, the agreement for services between Lake County General Health District and Geauga Public Health, the addendum, that's undated also.
Okay, and
Second.
we have a second.
Second,
Ashley seconds.
need a roll call?
You want a roll call vote? So,
Yes.
Mrs. Brakey,
Yes.
Mrs. Roman,
Yes.
Dr. John,
Yes.
and Mr. Perino, yes. Okay, so that's tabled.
Okay.
And then this will give you time, Carolyn, to
Yep.
review it all.
Can I have, a Word doc of this?
You have to ask, I
It
think
looks
you
like
would
it's
have it,
scanned.
I don't get a copy of them.
Or is this just
A Word doc?
Send a copy and
Yeah,
stuff.
I'm guessing it came as a Word document. If it's not, it's a
I mean, I can just
PDF.
rewrite this if I have to, it's not that long, but if I could have a Word doc, that'd be
I'll send you
helpful.
a Word doc. If I have it, I'll send it to
Okay.
you. Okay, so,
Coming out of executive, no decisions made,
Not only was an executive, no.
no
good.
Yeah, just pending litigation stuff.
discussion. Okay, so the next, the next regular meeting for the Board of Health is at 5 o'clock on August 24th, 2022. It's going to be at this location, 12611 Ravenwood Drive, Suite 334. So.
And we're gonna look to do a special
We
board
might
meeting to
have it.
discuss litigation.
Yes.
Date
In between
undetermined.
then.
Yeah, we gotta talk to the lawyer first for a date. Everybody was, does that make sense?
Yes.
Yes.
Alright, so we'll talk to the legal team first.
So do we have a motion to adjourn?
Motion to adjourn the meeting at 8:56 PM.
Thank you. Second?
Second.
Mrs. Roman,
Second.
okay. All in favor?
Aye.
We're adjourned. Thank you, everybody, for